Right now, we're going to hear from DCFS. Hopefully, may not, but we'll attempt to get through their presentation and hear testimony. We have some things we're going to enter into the record on behalf of constituents who have requested us, but DCFS has its own presentation based on what the members had requested in previous meetings and updates regarding agenda items. You should have, members, that presentation in your folders, as well as you should have it on the computer if you want to search it that way. House members, did they? Thank you. Okay. Welcome to committee.
Good morning.
Oh, I apologize. Let me do one thing. When I saw Ms. Bowman, I originally told you, because I sometimes revert in my mind, Madam Chairperson, if we can, at 12:35, we're going to take a break, not a break, but if we can switch over. We have someone coming to address the SNAP benefit issue. I always revert back to it being in DCFS, and then LDH has reminded me that it's in their committee regarding the emergency procedure. So for about 5 or 10 minutes, someone's going to come and discuss what happens for the constituency with emergency procedures when you need SNAPs in the event of emergency, and that's going to be about 12:35. Should take only 5 or 10 minutes. Welcome to committee again, Madam Secretary.
Good morning. Good morning. Rebecca Harris, Secretary for the Department of Children and Family Services. Thank you for allowing us to present this morning. How do I get this? Okay, thanks. So the mission of the department, as amended in Representative Carver's bill in 2025, was really straightforward, and this was after the one-door initiative that moved certain parts of the department out to other agencies. And what it left was that DCFS was responsible for the protection of children, empowering families, and strengthening communities. So the question that we are going to talk about today is whether the work that we are doing
I apologize. Senator Barrow has a question.
Yes. Thank you, Madam Chairwoman, and good morning. Good morning. Yes, still morning. I have a quick question because we got this text last night at about 9:43 that the presentation was different from the initial presentation that we received.
Senator Barrett, I could answer that question for you. I am Dr. Rebecca Hook. I'm the medical director for the department. There was an error that was made on one of the slides, and that was my fault. I had transposed the number incorrectly, and I wanted to make sure that y'all had the proper numbers, but I believe it was slide 24.
Is that the only change?
There was one other change that I made on slide 23 because we closed 2 cases in backlog, and so I wanted you to have the additional numbers of substantiated cases. I did not want to falsely give a lower number, and I wanted to make sure you all had the most up-to-date numbers.
So pages 23 and 24, yes. Can you just highlight those for us right quick before the Secretary starts?
So on slide 23, the number for full year should be 29, not 27. And those 2 cases were closed in backlog. And on 24, the number for 25 should be 7, and the number for 26 should be 9. And I'm sorry, that was a transcription error on my part.
And it's been corrected in this new copy we have before us today.
I hope so. The copy I have is corrected.
Okay.
23, the total should be 29.
We sent the corrected copy.
On slide 23.
23.
Yes, I'm saying 29 and 25.
Yep, those are
Okay,
correct numbers.
that's correct numbers.
Yes.
Okay. Okay. Thank you. I appreciate that. Thank you, ma'am. That's all.
Okay, thank you, Madam Secretary.
Okay. So since session wrapped, we have been intensely focused on the overall goal of really rebuilding trust with the department, both with our staff internally, all of our partners, our stakeholders, and also looking at the primary factors that result in improved outcomes for children and families, which are really workforce stability, workloads, practice models, and continuous quality improvement. When you look among other states that have good outcomes on their children and family services reviews, those are common elements among them. So are we where we desire to be yet? No. We are not. There is still a lot of work before us, but we are much further along today than we were a year ago. In some areas where we have actually accomplished more than we have over the last several years combined. What we looked at is that before we can fundamentally change practice that results in better outcomes for our children and families, we have to have the capacity to do it. And before we do that, we have to ask that the workforce not be buried in thousands of overdue investigations and simultaneously redesigning how we serve children and families. And we also have to know that we can't hold people accountable for outcomes if the ownership is unclear. So those are areas that we have been focused on. Year one was all about clearing accumulated work that had existed for years, ensuring children and families waiting too long are safe and have the services that they need from the department, stabilizing the workforce, and putting the right structure in place. Those things are not the improvement themselves. That just gives us the conditions necessary to put improvements in place. Child fatalities, even considering the conversation that was just had with the death review panel, have understandably received a significant amount of attention, and they should. It receives a significant amount of attention even within our department. Every child death deserves some serious examination, and we have been working under the critical incident review model since December of 2025. To do just that.
Madam Secretary, I'm sorry to disturb you. My staff just gave me something. If you are Ann Spink or Callie Gonzalez, I'm going to pass your cards to the Sergeant Orms. There's no item listed on them, so she doesn't know how to categorize you for us to call you up regarding this. Sorry about that. Go ahead.
The broader systems examination as part of Act 960 that'll be led by the Attorney General's office will convene before the end of the year, and that's something that we are really excited about because it allows us to look at the broader system that serves children and families. So today we're going to provide some data to you, explain what the numbers represent, and spend some time talking about what that data and information has taught us and how we have used it to improve outcomes for our children. The value of reviewing a fatality is not in producing just more numbers and reports. It's really in identifying what could prevent the next fatality. That's true for every child fatality reported to and investigated by the department, and not just those that have been substantiated for abuse or neglect. And the same principle applies to all of our updates today. We're going to spend some time discussing the hotline and the improvements there, but the question is really going to be whether someone can reach us quickly to provide us information about a child who may be in danger. When we talk about workforce, the question is really going to be whether or not we have the capacity and experienced people with the appropriate supervision and tools to make sound decisions for our children. When we talk about the backlog of investigations, it's going to be the question of whether we're responding to reports of abuse or neglect and the children receiving timely attention from the department. Over the past year, we concentrated heavily on stabilizing the foundation. We have met with staff across the entire state. We've met with foster parents and partners statewide. We strengthened the Child Safety Response Center, reduced the investigation backlog, improved our workforce stability, and established the Critical Incident Review Team. We created an internal affairs function, added law enforcement expertise, and established a dedicated clinical team. So what we're looking forward to in the future is improving practice. That includes more consistent decision-making across the state, stronger quality assurance, differentiated response models. Ma'am? Oh, sorry. And yes, ma'am. And then full implementation of Act 960. So you will see today that many of the problems affecting children don't always start or begin with DCFS. It involves all of our partners in the continuum of care. That's why we talk about it being one accountable system, but DCFS has very specific roles that we intend to perform with excellence, and then the overarching responsibility for the continuum as a whole. So with that, we will move into the remainder of our presentation. Okay, so again, the standard by which we are measuring any accomplishments in the department is the mission that has been set forth, which is to protect children, empower families, and strengthen communities. Everything that we do comes back to the first responsibility, which is the protection of children. And so we're going to focus on whether the changes that we have been making are moving the department forward and improving safety and outcomes for our children. No child experiences the entire system in parts, and no child experiences time the way that the systems do. A child may encounter the Department of Children and Family Services, law enforcement, our CAC partners, healthcare partners, attorneys, and judges. And each of the partners has a very distinct role, but they all intersect around the child's safety, and the work that we do is to reflect that reality. This begins before a child enters foster care. Prevention, receiving the report, assessing risk, and determining whether a child can safely remain at home are all child safety decisions. Earlier and better intervention can prevent a family from reaching the point of crisis, removal, or, as was discussed at the last agenda item, the fatality of a child. When removal is determined necessary by DCFS and the court, the work does not stop with just placement of the child. The responsibility becomes preserving connections where appropriate, making sure that we have family services in place, supporting reunification for the children, and then achieving permanency as quickly as possible. So we have just a little illustrative example of how the continuum serves our children and families, and this is the case of Amaya. Child welfare doesn't begin with the assumption that every concern requires the same response, and removal of a child is not the measure that we took a case seriously. So in this example, there was a safety concern for Amaya. We identified that her mom had substance use and inadequate supervision, but during our investigation, we also identified a relative that could help protect her and community services that could support the family. So that allowed the department to intervene while also preserving Amaya's connection to her community, her school, and her family. During this case, when the risk increased and she could no longer be safely remain at home with her mother, the response from the department changed. So at this time, she was placed with her aunt, and that's not because the earlier plan that had been put in place had failed, but it's because the child welfare practice has to adjust when the circumstances of the case change. And the work then did not stop after she was placed with her aunt. Mom continued to receive treatment and services related to substance use. Visits between Amaya and her mom continued, and as progress was demonstrated, the case then switched to move towards reunification. So this is the practice that we are trying to build more consistently across the state, assess the actual risk, use family and community supports when they can safely protect the child, and then escalate when safety requires it. So today you've asked us to come and provide updates on 5 very specific items, which include child abuse reporting procedures, the reorganization and reclassification of staff, child abuse and neglect fatalities, including those of children in our custody, the implementation of Act 960, and then an update on foster care rates. As I had stated, year one was largely about stabilization for the department, hotline performance, backlog, workforce, review capacity. In May, we announced that we had joined the National Partnership on Child Safety, and we convened a policy roundtable here at the Capitol where we had invited members of the legislature to attend and discuss what policy could be changed and implemented in Louisiana to reduce the number of child fatalities. And we do have Dr. Cole from the National Partnership on Child Safety here today, who's prepared to provide some information. Other accomplishments include a prevention partnership that we have established with Women's Hospital to focus on our most at-risk youth, which are those who are age 0 to 3. We have developed and begun filling positions on our clinical review teams that support the medical, mental, and behavioral health services that are provided to the children that are in the custody of DCFS. We onboarded staff who work directly with LDH Medicaid to make sure that the services that our children need are being provided and that our foster parents and our biological parents are also supported. We have preserved survivor benefits for our youth in foster care, and we are investing those dollars so that they have a better foundation for their future. But the more important part of this is what we are going to do next, what's going to happen in year 2, and how the foundation translates to improvements to the outcomes for children. That's going to include better practice models through right response, which we will talk about in a bit. Home Ready, which is for our foster parents to be able to train and certify more quickly. Overall system modernization, stronger clinical and quality functions, and then a home for every child. And a home for every child is a really important initiative. It's authored by the Administration for Children and Families, and Louisiana was among the first to sign on to this, but every governor in the country has signed on to this initiative. And what it means is that we have quality practice that keeps children at home whenever it's safe and appropriate to do so. And if a child needs to come into care with DCFS, that we have ample quality families to provide for any of the needs of our children. And then lastly, it means that we move children to permanency as quickly as possible so that they don't linger within the foster care system. And I want to address very quickly a concern that a home for every child may encourage us to separate siblings in order to achieve the 1-to-1 ratio. It does not. And ACF, the Administration for Children and Families, specifically says that the measure does not preclude placing multiple children, including siblings. And so again, the goal is to have a quality home that matches the needs of our children, even if that means a sibling group of 3 or 4 or 5 or upwards of 8 that we have had experience with. And then for our sibling placement, we do have federal data on that. It is an area where Louisiana does need to continue to improve, but there is documentation that it has improved over time. We are subject to an independent federal child and family services review, and in 2016, that review found that 53% of our cases had documentation of reasonable efforts to have children placed together. The next review that was conducted was in 2025, and that rating had improved to 84% of our cases had documented reasonable efforts to place siblings together. So we want to continue to see that number move up, but we have been moving in the right direction. So the first item that you asked us to give an update on is the online, email, and hotline child abuse reporting procedures. Yes.
I sat back in the chair and didn't realize.
Wait until, why don't we just take these one by one, just to let the secretary
Okay,
presentation
yes,
per agenda item.
thank you. I saw your red button, Mr. Chairman.
What's that?
I said I saw your red button.
Yeah, I was just.
Okay.
Getting ready. Getting ready. So the front door of child welfare is our hotline, the Child Safety Response Center, and it has to be accessible and clear for anyone who is outreaching to us, and particularly mandated reporters. About 70% of the reports that we receive do come from our schools. And then we also wanted to make sure that if there is a child in foster care who needs to get in touch with us, that there's a very clear reporting path for them as well. So reports enter through several channels, but emergency concerns always belong on the hotline. One specific change from Act 960 that we wanted to call out here was that effective January 2027, mandated reporters who call the hotline to make a report do not have to then follow up again in writing. Today, when we receive a report, they are assigned based on risk, with higher risk cases receiving an investigative response and lower risk cases being handled differently with assessments. And the important point in this is that risk determines urgency and response, not simply whether someone called the hotline. The timeline right now to respond is as little as 2 hours for immediate risk, and these are typically the reports that we're receiving from law enforcement or healthcare providers because there's a child in a critical situation at that moment. And then the longest response timeline right now is 5 days. And later we're going to talk about how right response, which we have learned from the critical incident reviews, will help us to improve this. An investigation can produce multiple outcomes. A child can remain safely at home with services or under court supervision. We may determine that the child needs to be removed. A case can be substantiated, inconclusive, unsubstantiated, and in very rare circumstances, but they do happen, there may be the case where knowingly false reports are made to our department. And I just wanted to point out that regardless of whether a case is substantiated or not, any family that becomes involved with DCFS does have the ability to receive either referrals to services to support them or services provided directly by the department. The changes in our Child Safety Response Center have measurable areas of improvement since we implemented some reforms in September 2025. In July, because we have the complete data as of July, 95, almost 96% of all of our calls are answered. The average speed to answer, which is the amount of time from when somebody selects why they're calling till we have an agent on the phone, is 39 seconds. And callers who hang up while waiting for an agent to join the call is at 4.1%. When we compare that to January of this year, the average speed to answer exceeded 4 minutes, and there were times where it could be upwards of 20 or 30 minutes. And when we think about the cases that need immediate response from the department, law enforcement and healthcare individuals, they don't have the luxury of that time to wait for us to join the call. So we're very proud of these improvements and how we're serving reporters. The second update is on reorganization of the department and reclassification of staff. This structure was built around making...
Questions on that first, and we'll take it one by one. Before Chairman McMath asks his questions, I see under this removal is necessary under an emergency that the judge has to sign. Now, is that true for foster parents? Can DCFS make the decision to remove children from foster care parents where incidents have occurred?
Yes.
Okay. What about under emergency situations where it's a biological parent? Can you remove under emergency circumstances and then ask the judge to make the removal permanent?
Yeah. Do you want to take that?
We don't, Connie Guillory, Assistant
Yes.
Secretary for Child Welfare. We don't have the authority to remove a child from a bio parent without a judge's order.
Okay. So explain that procedure to me. It's tier 1?
So if a tier 1 case is a high priority case
Right.
where we go out immediately. And when we go out for the investigation, if we identify any safety issues, any threats that can't be mitigated by a parental capacity, we have to call the judge and get a verbal and an instanter. So there's no written process, but we still have to call the judge and get
And
a
how
verbal.
are you always able to get a judge at that moment? Let's say that happens at 2 a.m. Is there a judge that answers the phone at 2 a.m.?
We get a rotation of judges, Senator Andrews, and we can get our judges.
Yeah, I just wanted to make sure. So there is a process, because when I see it, I'm like a judge, I'm thinking signature, waiting till in the morning. So you do have a process where removal of a bio parent can be immediate based on certain circumstances?
Yes, ma'am.
Okay. Mr. Chairman?
Thank you, Madam Chairwoman. Thank you, Madam Secretary, for being here today. You mentioned in your opening that the goal of year 1 was stabilization of the department. Do you think that as you near your first year, you think you've achieved that stabilization?
To the extent that we'd like to, no. But again, we're much further along today than we were when we began.
Okay.
So
no
we'll-
trick questions here. Just curious.
Yeah.
Yes, I'm just curious if it's a yes or no.
Yeah.
Would you agree that the stabilization of the department would include, placing well-qualified individuals in leadership positions or key roles?
Yes.
Do you agree with that? It's my understanding that Lacey Sims, who had a pretty extensive child welfare experience and was placed in charge of the new centralized intake call center, somebody that I enjoyed and respected working with, is no longer with the department. Could you tell us who's in charge of that call center now?
So Miss Wendy Barber is in charge of the call center now.
Wendy Barber. What experience does she have in that from like a child welfare perspective?
So
Where did Wendy come from?
she has run.
Miss Barber, I should say. Sorry.
She has run call centers for Medicare, other insurance markets, and Medicaid. And when we were
Does she
talking
have child welfare experience?
child welfare, no.
Okay. One more question. At the Women and Children's Committee hearing on March 10th, DCFS testified that they were working with the APCO to develop a first-of-its-kind child welfare intake training. We've talked about that extensively. In fact, that was something that you had mentioned in the meeting that we had, back in, I was in Covington, I guess.
October 2025.
October 2020, right after you took over. That training was scheduled to take place on May 25th and June 14th. I believe it was 2 phases, and it would last 4 days each. Employees would take a test at the end of the training, and if they passed that test, they would be nationally certified. Has that training happened?
So the training has happened. It has not been in the way that we originally intended.
Can you explain that?
Yep. So there was some changes in the leadership at APCO. And we had conversations with them, and even though they had helped us to develop the actual training materials, they were not able to certify it and be here because there were other items that had taken prioritization for them. And so
Like what?
they said their annual conference.
Okay. And that annual conference takes place annually?
I would assume, but I don't make
Okay.
decisions for APCO.
Yeah, if they knew that they had their annual conference around the same time that we were trying to get these folks trained and certified, it just seems like that would be something that would be obvious for them to know. But
Yeah, and the other part of that is that they had changes in their leadership. So what was priority to previous individuals in leadership was not priority for those that were coming in.
okay, so I'm assuming that the employees haven't had the opportunity to take that test and become nationally certified?
No, but the training that they are receiving today is that training.
Okay.
So it's built on all principles from the public safety space and then also child welfare.
All right. You were pretty adamant that May and June deadlines would be hit, and it's August 17th. So I'm just trying to understand. Obviously, there's some things that were out of your control, particularly with APCO. But do you have any other comments on that?
No, just that the training that we had intended for them to deliver, which is more specialized and based on public safety principles, has been delivered.
Okay.
They just are not certified by APCO.
I'll give you a softball here. From the chart that you provided us dealing with the long hauler weights, there was it looks like there was a pretty substantial, and I'm talking about this graph here.
Yes.
And again, I had the opportunity to just review this later last night and this morning with the updated reports that was handed out. But it looks like there's a pretty substantial drop off between November, December. Can you explain what you would credit that to?
Yep. So a couple of things. One, there had been conversation during last session about portal request.
Portal requests?
Yes, portal reports, sorry. So individuals can submit reports via an online portal, and most of those are either to non-life-threatening situations, or it is that follow-up report that is coming from our healthcare individuals. And so that was an area where there was a backlog at one point in time, and so as we removed that backlog, it means that we're working in real time. The other changes...
You're shifting essentially would that come down to a volume issue? I mean, where you're reducing the volume of calls, and thus you have an opportunity to... Is that what you're suggesting?
No, because if you look at the chart above, the volume of reports and calls that we've received have not significantly changed over time.
I see that.
So it's changes to making sure that there are policies and procedures in place as to how work is to be prioritized and completed. We also made changes where staff were working at home, and we brought them to a centralized location in Baton Rouge, and that did result in some immediate improvements in outcomes and times.
Okay. That's all I have for now. Thank you.
And I am going to attempt to do what we did after the members asked questions on our presentation for LDH, which means that if any person who filled out a card has a testimony or a question regarding testimony really regarding an item on the agenda, we take it up at the same time so the department can address it. I think we discussed that, addressing some of the general public issues. So right now, Senator Barrow has a question, but we're on agenda item number A, update on online email hotline, child abuse, and reporting procedures. I also want to recognize someone near and dear to my heart that grew up in Monroe, Louisiana, and unfortunately left us and became an attorney and will not move home. Attorney Desiree Cotton is in the audience. I want to recognize her, too, for her work that she is doing in child in need of care cases. At this time, once the Secretary finishes with members, if you have anything you'd like to add, since you are boots on the ground, that's what I call the child in need of care attorneys who represent handle these cases as boots on the ground because they see firsthand what is happening. Of course, you're welcome to come up at any time. We have a member. I want to call you a member. I keep looking at him. He's just sitting there, right? It is sad. I keep trying to call you my member. I don't know why. I always refer to you that way. But, of course, anyone else, if you fill out a white card, I have your agenda item as DCFS. I have the foster care items, foster care parents. I have you. But if you had an issue, that you like to address with the reporting or how calls are taken, this would be appropriate time when I call for testimony on that, okay? All right. Thank you. Madam Pro Temp for a question.
Thank you, Madam Chair. I want to go back to part of your introduction, I believe, Madam Secretary, when you talked about the establishing of the law enforcement liaison position. I think you kind of spoke about that in your introduction. So that individual has been brought on board?
Yes.
And so when were they brought on board?
So we had been working since you had originally brought up the idea of wanting to have someone in law enforcement. We began recruiting then, and so we brought him on board in May. He signed his conditional offer of employment and joined us, but he retired from state police in internal affairs investigations, has great relationships. He has actually helped us to build out the internal affairs investigative procedures that we have in place now. And then he also is helping to develop investigative trainings for our frontline staff in child welfare. And then he bridges the gap with all of our law enforcement partners in the state. So it's been an incredible person for us to have on the team.
So he is serving as a resource for law enforcement referrals, and he's facilitating joint investigations between the department and law enforcement
That's right.
as necessary. So that's what he's doing now.
Yes.
So what cases, can you speak to any cases in particularly he's actually addressed since he's been brought on board?
I will say a case
Is he
that...
here?
No, he's not here today,
Okay.
ma'am. A case that he is still working and coordinating with law enforcement now is the one with our baby that was in foster care, and there are charges pending against the foster parent.
Which one is that?
Can we say the name of the case?
Because it's more than one.
So
No, there's not.
It's not more than one?
Foster child, where the
Yes.
foster parent has pending charges against them?
No, there should not
There's
be
only
more than one.
It's only one?
There should
Yes.
be only one
Okay.
that I'm aware
Let
of.
me make my legal statement because I should have made it. You may refer to case A, case B. If it is a pending investigation, I think we have learned this from committee meetings. Now, if it's public record, then the problem is the name may be public, but your ability to discuss that specific case.
Oh, I wasn't going to ask
know,
any
I was just
specifics,
telling them,
but
like,
I was under the impression there's more than one. But I was trying to find out the role of the law enforcement officer. That's my main question here in
Yes,
terms of what
it's
it's a he, right? He's
yes.
doing, yeah.
Yes,
Okay.
Mr. Ducote. So he is serving the role that you intended, which is coordinating with law enforcement
Okay.
agencies across the state, coordinating with state police. He also stood up our internal affairs investigative unit, and again, he is developing more specialized investigative training for our child welfare investigators. So
Okay.
bringing that law enforcement expertise into the practice of child welfare.
So they've had training already with some. He's actually already done some of that already.
No, he's developing that now.
Okay, he's developing it.
Mm-hmm.
Okay, all right. Thank you.
Yeah, and Senator, I was not implying that you were. Anytime we get into this discussion, I give that warning about pending investigations. Being a criminal defense attorney, you know how public information can mess up a case. And so when it's an investigation of abuse of a child, we want to narrowly tailor that discussion that, defense counsel does not have an opportunity to use anything said here to relieve their clients of, to relieve us of seeing justice done for that child. Senator Mizell.
Thank you, ma'am. Thank you, Madam Chairman. Hi. Good to see y'all.
Good morning.
Something struck me, and I see it on the organization page again, about clear ownership, and because you'd said in your opening, if the ownership is unclear, tell me what in the practical sense, what does clear ownership look like to you?
So clear ownership is when the work is assigned to a person who then is accountable for the outcome of that work. What we found, and this is under Ms. Guillory, but what we had found is that a single process would be fragmented amongst many individuals, some in field regional offices and then some at state office. And so if the outcome was not the desired outcome or it was not in line with policy or practice, it was hard to determine who was actually responsible for the outcome. So by having more clear ownership, every policy and every procedure lies with a person. And then that is organized into the units that we have reestablished.
So there would be an opportunity for a carrot or a stick, because you're going to know that. So there's no passing the buck.
That's right.
So that's clear ownership to your mind.
Yes, yes.
So with that, I mean, you said at the beginning being when a child comes in to care, all the way back to this is something I know we've talked about for a long time, but when you have the hotline numbers, what's the percentage of because it's like a few pages, I don't think we've gotten to it yet, but investigative data. So of the calls, when they take a call in 39 seconds and the average time is 19 minutes, how many of those go to the next step?
So if you look at the data from 2025, we screen in about 23,000 of the calls that we receive are accepted for investigation. The handle time is important because we've gotten, one of the things Ms. Barber has done is gotten more clear on the questions that we ask. So for instance, there was a very prescriptive script of what we would ask individuals when they called to make a report to us. And so for example, if we had someone from the emergency department calling to inform us that the child had been brought into the hospital and the circumstances of their injuries, there is not a need for us to ask that reporter what the condition of the home is, whether, who all is living in the home, whether there are firearms in the home, because that's information that they would not have. And so the questions that we're asking need to be relative to the information that the reporter would have. And so that reflects in some of our handle time changes.
So you feel better? You feel better about the way the decisions are being made for the referrals to the priority 1, priority 2?
Yes.
Yeah. So with that, and the clear ownership, so I'll wait. I'm going to wait. Thank you.
Okay. The board is clear. I have to ask from the general public who's here, even if you didn't fill out a card, if you have a question, comment, concern about intake on item number 1, update on online email and hotline child abuse reporting procedures. If you have information you would like to give regarding reporting procedures or recommendations, now would be the time. Okay. Looks like everybody card is on another agenda item. Madam Secretary, we're on to agenda item number B. Agenda item B, update on reorganization of the department and reclassification of staff.
Okay. All right. So reorganization of the department and reclassification of staff is our second item. The structure was, again, structured around making sure that we have clear ownership and also making sure that we are placing all of our staff as close to the children and families that we're responsible for serving. So in this structure, direct practice owns all of the casework. Medical operations brings clinical expertise into the care of our children who are in the custody of DCFS. Care Connections owns all of the recruiting, training, certification, and matching for homes and facilities with our children. And then training and CQI is responsible for consistency and quality among the work that we are doing. The objective is faster escalation of risk and less variation in practice across the state. And I will note that the reorganization and reclassification of staff is completed by both DCFS and Civil Service. Our overall vacancy rate is 11.2%. But one of the areas that we focus on the most is that direct practice, because those are the services directly to our children and families. And in that area, that's where 82% of all of our positions in child welfare are located, and their vacancy rate is 8.3%. The highest vacancy is going to be in the areas where we just restructured. That's training and continuous quality improvement, medical operations, and planning and programs. And we do have those positions posted right now, and I think more than 50% of them have a conditional offer of employment on them, and we're just waiting on those individuals to join the team. vacancy really tells us how many positions are unoccupied at a given point in time, but the turnover tells us, I believe, a more important factor, which is of the individuals that we are bringing on board, are we keeping them? And what we can see from this is that turnover had peaked at 27% in 2023, and then it fell to about 19.45% in 2025, which is below the average of the 15 years that we had data. Our 2026 rate is still lower yet, but that stability really matters because it means that we are growing expertise within the department. We can rely on more consistent practice among our teams, and it really will directly improve outcomes for children and families. Because again, if we look at what the Child and Family Services review data tells us, it's that workforce stability is one of the 4 core drivers of improved outcomes for children and families. And do you want me to pause? You had a 12:35 stop?
Let me see if they are here. Is anyone from LDH to talk about emergency snaps? Have you arrived yet? Okay, no. We're going to keep going. Senator McMath for a question.
Yes.
Thank you again. Madam Secretary, we've had a lot of conversations regarding the CPS caseloads and backlogs. Obviously, there was a WBRZ report that came out at the end of May where employees anonymously spoke. God, that seems like decades ago, doesn't it? At the end of session. Not necessarily because of this, just because the session was so much fun. Where the employees anonymously spoke out about high caseloads and employee burnout. It's just something that we've all had discussions with. What is the highest caseload? And if you said it, forgive me. I was actually the Senate president that called, wanted to talk about something. What's the highest caseload a worker is carrying right now?
So I did not bring that number with me, but what I will tell you is that came from our Baton Rouge office. And our Baton Rouge office, or the Baton Rouge region rather, has struggled more than other regions. So when we talk about backlog reduction efforts and so on, every other region in the state has been able to eliminate their backlog.
Eliminate it entirely?
Mm-hmm. Yes, Baton Rouge has not. And so we have been working very diligently to find out what the challenges are in that office. You'll probably recall in 2022, 2023, there were a lot of efforts that were put in place particular to that office. Changes in deferred cases to have them be worked in other areas, bringing in strike teams, bringing in staff augmentation. There's a lot of things that have been tried, but none of them have yielded the results that everyone desires to see. And so there have been some changes that have been put in place by Ms. Connie that we are expecting to start seeing improved outcomes in that office.
Okay, but just to be clear, your testimony today is that outside of the Baton Rouge region, the backlog has been entirely eliminated for these caseworkers.
Yes, I believe. Do we?
We have probably maybe 20 or 30 cases in some of our regions, but they are because we are waiting on medical reports or we're waiting on coroner's reports. But Baton Rouge has a significant amount.
And Baton Rouge has been
Yes, sir.
has been an issue since as long as they've struggled. I shouldn't say they've been an issue; they've struggled.
But
So I understand that. Let me ask you this: so to be clear, you're suggesting that an average caseload across the state outside of the Baton Rouge region would be 20 to 30?
About 25, yes, sir. The average. And we're talking about CPS, Senator McMath. If
Right.
you look at foster care, it's a different number.
Okay, I have some employee caseload information that it's from April of 2025, right? That was provided by the department. There were employees, and I believe this is outside of the Baton Rouge region as well. This is not just inclusive of the Baton Rouge region. There were employees at the time with caseloads of 75, 90, and even 165. In comparing that list to a list of current DCFS employees. It looks like a lot of those employees are now gone. I know we lost a number of folks. I also have a list of DCFS employees from March of 2026 and July of 2026. And out of the 89 CW specialist trainees that were employed with the department, 24 have left by the end of July. So we've went from 89, we've lost 24 out of the 89. And my question is going to be, how has the department been able to reduce caseloads and clear backlog cases when employees leave and shift those cases to someone else who either has an equally high caseload or is too new to carry more than one or two cases? I guess what I'm saying is help me make sense of the math. If we've lost a significant, and you could disagree with these numbers, be happy to show you the information that I'm looking at. But if we've lost 24 of the 89 trainees, we've lost employees. Obviously, those caseloads get shifted to the ones that remain. Help me make the math make sense.
I'd probably have to make it make sense per region, because what the regional area directors did in November, per my directive, is develop a backlog burn down plan for their region that was specific for their region, for their numbers. And so the work is hard.
Oh, yeah.
The work is
no
very
doubt.
hard. And some of our staff select out because of certain reasons. Some are selected out. And so to really make your math make sense, I'd have to look at the regions that you're looking at. I know we've lost a significant amount of our trainees. Sometimes you just realize that the work is not for you. But I can't tell you that that's the reason for every trainee,
Sure.
to be honest.
And again, I've said this many, many times to you, Madam Secretary, as well. This is an impossible job.
Yeah.
So I understand that. Why don't I do this? Why don't, as this meeting concludes, I'll send you an email of breakdown of what I'm looking at, and then you can help me
Yes, sir.
make the math make sense. And one more question, Madam Secretary, on this issue, Madam Chairwoman, excuse me. Some of the initiatives the department has announced as part of its transformation of the Louisiana child welfare system are Right Response, and Community Pathways Network. What has the department done so far with those initiatives? Those are initiatives that you'd spoken about in the past. Just if we can get an update. And again, if I missed that part, I'm sorry.
No, we hadn't got there yet, but that's okay. So Right Response changes fundamentally the practice model. So what we have heard often, what we have examined from the critical incident reviews, and then also what we have heard from you is that we don't want children to be screened out. That anytime someone is contacting our department, it's because they have a real concern related to the safety and protection of a child. And so what Right Response will do is change the model to where we do not screen out reports. And in order to do that, we needed to first complete the reorganization and restructure of the department, which was completed earlier this month. And then Ms. Guillory is working on finalizing the policy that aligns with that, because there are more.
Are you talking about the Community Pathways Network?
No, Right Response.
Okay, Right Response. I'm sorry. Right.
Yes, because today you have high risk and intermediate risk and low risk. In the future, you will have more risk levels, and so they are finishing the policy around what is the criteria for each of the risk levels, and then we will also be asking y'all to help us with some legislation next year, because again, today, the Children's Code provides that the longest response time is 5 days, but for children that don't have any immediate risk and more likely just need to be referred to services or have an assessment in the home, we're going to ask that those have up to 7 days so that we don't overburden the staff. But investigations where risk is higher and safety is a concern, those would still be investigations responded to.
If I may for a second, I apologize, Mr. Chairman. If you are in the audience, looks like we won't get to audience testimony again before the break. Our cafeteria upstairs, if you were planning to eat there as a member of the general public, it closes at 1. So if you're looking to eat there, you probably want to go order. Otherwise, when we break, you'll have to go outside the building. I'm always very courteous because I've sat through these committees as a staffer and as a member, and a lot transitions in the Capitol when we're not in session. Everything closes earlier. So I just wanted to note that to you, okay? I apologize, but we will not get to any public testimony before we take a break. Thank you. But we will receive public testimony when we come back. Thank you. I apologize, Mr. Chairman.
Trying to remember where we were.
Senator, you were with, you had asked about Right Response and then Community Pathways Network.
Yes.
All right, so Community Pathways Network, that is the broadening of the community-based care that is provided to children and families. So today, it is the My Community Cares model, and it has a finite number of services. Under the expanded model, we were going to have more direct services to children and families related to prevention, preservation services, and then all the way to post-permanency. So even after a child is reunified with the family or after the child is adopted, making sure that we have more supportive and in-home services available to them. That is slightly delayed. We had wanted a September 1st go live. We are not going to meet that because we are doing a lot of work to make sure that the funding behind it is appropriate. A lot of the services that are provided are eligible to be reimbursed by Medicaid, or they are eligible for 4E prevention funding, which is another federal grant. And so we've been working with the Department of Health very closely on what those look like, and then making sure that we have state general fund match for the other parts.
Who are you working with at LDH?
What's the lady's name? Office of Public Health.
We'll get the name.
We'll get the name.
Okay. Very closely. I mean, you'd think you would know the name of the. I'm not trying to put you on the spot. All right.
Come to me in about 5 minutes.
That's okay. All right. That's all I have, Madam Chairwoman.
Senator Barrow for a question. And members, we're going to break a little early because your food has arrived after Senator Barrow asked her questions, and we'll come back on the record at still at 1:45. Okay, Senator Barrow.
My question is going to be, I really have a lot, but I'm going to try to make this quick and we can resume when we come back. Baton Rouge. I want to talk about what's happening in Baton Rouge. So why is it that we don't have that person yet in place?
Which person are you referring to?
Okay, so early on we was talking about Baton Rouge not. We're the only parish, seemingly, to have the cases or unresolved cases or the high caseloads. Why is that again?
So there's a multitude of reasons why. We have met with staff in that office who have communicated to us that it is related to leadership within the office. We have...
Have you met with the leadership in the office?
Yes, we have.
Okay. Has it been your assessment that that is the issue?
It is my assessment that there are circumstances that have been brought to our attention where the support supervision has not been provided to staff in a way that they have asked for it, and
From
that they're
your behalf or on behalf of the department, or from whom?
supervisors within the office.
Okay.
Are they state employees?
Yes.
I'm sorry. We're going to break after her questions, but can you have someone who supervises that office to be here after lunch? Because it seems like there are a lot of questions concerning it. Go ahead, Senator. I apologize, Madam Pro Temp. I just want to make that request so you can, this is always an issue.
Because
We need to get to the bottom
this is
of
a
it.
problem if it's only in EBR. Go ahead, Madam Secretary.
Yeah, and I'll say we have made changes in staffing within that office. We have brought in individuals in leadership from other offices that are very successful. We have brought them into the Baton Rouge region so that they can start leading the work, and then we have made other changes as it relates to supervisors and staff within that office.
Are there any external circumstances that make this work more difficult than in any other parish?
More than any other parish, I'd have to think about that, but initially I'd say no. The risk factors in the cases that we see in East Baton Rouge Parish, we also see high numbers of the same type cases in Rapides Parish and others. And so I'd have to think about that question.
And the reason why I asked that question, because typically Baton Rouge and New Orleans are kind of like running at the same rate. And now that I hear that it's just us, it's really concerning for me. And I really want to drill down a little bit further on that. I'm just going to go really quickly to the Community Pathways program. So it was my understanding that many of these programs would be in place by the summer, by the summer. So, and I heard you say that they are not, kind of expecting them to come on maybe online in the fall.
Yeah, so the services themselves are still being provided. The services that have always existed are still being provided today. They're just not under this one coordinated community-based care system. So there may be multiple different providers. And our vision is that when a family needs to receive supports and services from DCFS, that they don't have to go to many other different providers to seek those services, that there's one conductor, coordinator, if you will, of all of the services. And so we can refer individuals to that Community Pathways Network provider, and then they would coordinate all of the services.
So that still is not established, so we still don't have that seamless pipeline.
The seamless pipeline is coming. It's a fragmented pipeline today.
Yeah, that's what I'm saying. We still don't have it. I mean, I remember you guys sharing this some time ago in some of the other hearings that we've had, and the goal was to have it in place by the summer, which is what I remember hearing, and I'm hearing that it's still not in place. Do y'all know what the issues are?
The issues are some related to changes internally and knowledge transfer not happening as successfully as we would like to happen. And then, again, additional conversations with funding sources to support the work and what is to be provided by Medicaid and Medicaid providers and what's to be provided by others.
Is funding a big part of it?
No, ma'am.
Okay.
The funding is there. It's restructuring the funding.
Okay, gotcha. Okay, because I want to kind of be clear about that, because I thought that we had tried to allocate as much support as needed to ensure that these components were in place. I guess I'm really just kind of struggling with some of the things that I was expecting that we would have had in place by now. Because I knew we've been having these conversations for some time, and I kind of thought that by the summer, which is what we were kind of told, that especially regarding the support initiatives would be in place, so that we would have the gaps that currently exist. Okay. Just leave it at that.
Members and Madam Secretary and staff and the we're going to stand at ease until 2:00 p.m. At such time, we will continue the discussion we're having and take public testimony. During that time, if there are any issues that come up, I would suggest you email the members' district offices. They're going to be in the back eating and trying to get organized a little bit before we come back, okay? I think we were working with Madam Secretary of DCFS. We were on agenda item 4B on the reclassification. Did you give your full presentation? Yes.
You want to start there with our Baton Rouge management?
Oh, Baton Rouge. Okay, we did request it. Baton Rouge is here. Yes. And you're going to see us do this sometimes, because sometimes it's really hard for us to communicate all the problems our constituents are having. So when a constituent wants to communicate directly on the record with us what's happening, we try to make time for that, because then you're better able as departments to resolve their issues and talk to them and see where the kinks are. All right. Welcome to committee. I have one from Ms. Kimberly Sashery, and you have a card?
I do. Leslie Lyons. I'm Deputy Assistant Secretary over Direct Practice.
I have it, Ms. Lyons. Welcome to committee. There were some questions, just to give you a background, and I'm going to cut Senator Barrow on. There were some questions about the constant backlog regarding the Baton Rouge office and trying to figure out what's happening. Is it resource issues or whatever? I'm going to cut the senator from your area on. Senator Barrow, Madam Pro Tem.
Thank you so much. So tell me your name again. I'm sorry, ma'am.
It's Kimberly Sashery.
Sashery?
Just like the seasoning.
Okay,
ma'am.
Sashery. And so,
That's your people?
By marriage, yes, ma'am.
that's funny. So how long have you been with the department?
Just under 21 years.
Just under 21 years. And you have been in the Baton Rouge region the entire time?
I have not. I have held many positions within the department. I've been
Okay.
in many different parishes. I started as a trainee in the foster care program in Tangipahoa. I've worked in Livingston. I've worked in Baton Rouge. I've worked in New Orleans. I've worked in St. Tammany. I've worked in Alexandria. I have held, now with this position that I'm in as an area director, the only position in the org structure that I haven't held is a regional administrator.
Okay. So can you kind of elaborate about this backlog that we have here in this region?
Sure. I came to the Baton Rouge region as the area director on March the 30th of this year. That was my first day. I previously worked in the Baton Rouge region as a supervisor from 2012 to late 2015. At that time, when I was a supervisor, Baton Rouge looked a lot like it does now. The backlog was astronomical. What's different now than what we had in that time frame in 2012 to 2015 is the number of staff that we have, and the volume and complexity of the cases that we have coming through Baton Rouge region. Because of the volume and the complexity of the cases that we have in the Baton Rouge region, it results in a lot of things that tend to cripple us, said Senator Barrow. We have trouble maintaining staff because of the amount of work, the type of work, the long hours, the no work-life balance, those things, the obvious. But then we also have, it's not uncommon, Senator Barrow, and you know this because this is your district, for us to have 3 to 5 life-threatening injuries or fatality cases in the Baton Rouge region a week sometimes. And so it takes a toll on staff. And in those cases, it requires much more experienced legwork and follow-up and case decisions and staffings and those types of things. Well, when you have the staffing problems that I am experiencing in my region, I don't have the ability to say, okay, you got this horrible case that we're going to train you, teach you, model you, grow you on, because now we have this other one, and I only have 6 people to take cases. And so it's a vicious cycle. And so it's, for lack of a better way of, it's like we're running from fire to fire to fire to fire, you know? And it complicates things. It cripples us because we're not able to train them as we identify those training deficits.
May I ask a question?
Sure.
Baton Rouge is the capital city, always has been. But after Katrina, we saw a major shift to Baton Rouge, and we're seeing that shift growing. We notice it in our traffic and everything, right? Was Baton Rouge ever right-sized? Meaning, did we ever, in that Baton Rouge office, account for the number of people who had shifted here?
Are you talking about staffing numbers?
Staffing rise, right.
I cannot say yes or no definitively from where I sit today.
When you got there 20 years ago, you have 6 people now.
I have 6 people now. I'm supposed to have 21 for the region.
That is drastically low.
So when you got there, how many were you
But-
supposed to have? No, I'm
So
asking.
I was going to, so she has positions, there's vacancies. So when we looked at the turnover numbers and the vacancy rate, you see, direct practice for the state is under my purview. And although our vacancy rate is fairly low right now, the primary vacancies are in Baton Rouge. One of the things historically that has impacted the Baton Rouge region, because I've worked there off and on over the years, is that Baton Rouge is kind of a talent drain, if you can say. There's a lot of opportunities for social workers and people who want to do this type of work in Baton Rouge and in New Orleans, which I've also overseen at a close level. And I've always compared them to one another. And I believe Senator Andrews mentioned earlier, like New Orleans, if they're not experiencing a backlog, tell me what the difference is. So,
But
Baton
you've had a
Rouge-
shift in population to Baton Rouge.
You've had a shift in population, but their volumes are fairly similar. So the CPS volume for Orleans and Baton Rouge is kind of neck and neck. And what we have seen happen in Baton Rouge is a lot of people who are, they go to state office, they go to work in other type jobs, they get promoted in other regions, and then we have a lot of people who leave because of the volume. I think the situation that we are in as we speak is a restructure, basically, of that office. Kim has come in as the new area director. I've come in as the over field services. Both of us started in March. We are, I've worked closely with New Orleans. I oversaw Thibodaux, Orleans, and the Covington regions for 9 years, I believe, as a regional administrator. So we have seen teams come in, work, get the backlog down, things seem okay, then it gets back up, people leave, all this. And so what we decided was we have to do something different. We can't continue to bring resources in from other places. We've got to figure out how to fix this problem. So right now where we are is we've looked at one thing that did work in New Orleans, and we had several people within the department went through the Lean Six Sigma program, and they developed projects. And one of the projects was a backlog project in New Orleans, and it was that less than 20% of cases would go into backlog, because backlog creates turnover, it creates stress, it creates families not having solutions, all of those things. And if we could prevent cases from going into backlog, then we could tackle the existing backlog. So New Orleans.
Madam Secretary, I'm sorry. I thought that we had done some restructuring where we had a night crew or something. I keep calling it
did.
a night crew. Y'all call it something else.
So we do. We have the second, I'm sorry, you asked the secretary and
Second
I'm
shift.
answering.
Second
We have
shift.
the second shift, and not only are we've hired for second shift, but we've discovered that we need supervisors specific for that second shift. So there's a posting that's live right now through the 20th, advertising statewide for second shift supervisors for each region. We also added some additional staff to the second shift. When we started it, we wanted to kind of see how things were going to go with certain things in place. So we do have that also, which will prevent, on-call and give people more of a work-life balance so that somebody can pick up at the end, at the end of the day.
What about the staffers, Madam Secretary, I apologize, that we talked about in this restructuring that were sent back to district offices who had more experience than their supervisors? We've been talking about keeping them and figuring out how to retain them. Have we looked at them to promote to second shift supervisors?
So we've actually used them in the regional offices where they went back to, and that's some of the reason that we were able to reduce the backlog and also prevent cases from entering backlog. These individuals are at a consultant level, which means they have subject matter expertise above and beyond any of our child welfare specialists. They used to provide expertise from state office to the regional
Right,
office.
right.
They are now in that local office. They handle backlog cases and then also the most complex, so fatalities.
Or are they positioned higher than supervisors?
They are, and they
Okay,
report
okay.
directly to the manager.
Okay, I'm fine. It's yours. I just don't understand.
So help me understand what's happening in Baton Rouge. So what are we looking at to address this? This really bothers me because at one time, Baton Rouge and New Orleans were the two parishes that were actually having these high numbers. And even somewhere up north, I'm not sure if it was Monroe or Shreveport, Alexandria. I knew it was up north. But I'm concerned because it seems like you guys have been able to figure out a way to address Alexandria. You've been able to figure out a way to address New Orleans even. But still here in Baton Rouge, we are still lagging behind. We still having way too many fatalities that are happening here in our area.
So, and that's what I was going to get to, is that staffing, the model, and I'm talking about staffing as in a supervisor meeting with their worker, having discussions on cases. One of the things we struggle with in child welfare is helping supervisors not get caught up, especially in CPS, with the emergencies. And so sometimes the workers don't get the time they need, that face-to-face time, so that you're sitting down, you're teaching, you're training, and you're providing the guidance that's needed. So this staffing model that was put in place in New Orleans was effective because, if I'm not mistaken, they had one case in backlog on Friday, and the only reason they had one case was because they were waiting on a medical report, which is phenomenal. I've not seen New Orleans have one case in backlog since forever in my career, and that's almost 29 years. So I'm just going to say.
So what are we going to do different?
So what we are doing. So this is what we're doing. One of the things that we've done right now, since we have, we're in the process of hiring people. They interviewed, I believe, 12 people on Friday for worker positions to bring them in. We're providing a different level. We've got consultants that are also in the office that are assisting. We're going to implement the staffing level. I'm pulling in people from other areas to assist with not staffing as in providing doing the work, but helping implement what does a good staffing look like? How do we provide support? We know the better and the quicker that we get the cases closed, that can be closed, the less burden. You start to see less turnover, all those things. It's not going to happen overnight. We also have some very experienced employees who are going through and reviewing backlog cases and making notes about what needs to be done, if anything needs to be done, or if the cases can be closed, so we can get those closed. We're triaging them. If something has been sitting and needs attention, that it gets the attention. And we're trying to do our best to support the staff who are really working hard. And then we have some who may not quite want to do the work. And so we have to help them figure that out, because the directives now and the expectations are higher, and we consider the workload. The workload is hard, and what we want to do is bring on people and help everybody have ownership in that office by saying, we're bringing on these new guys, but if you don't help support and train, if we don't all do it, then you're going to be back to carrying another abandoned caseload. So that's where we are. I think that I'm speaking for Kim in the sense that she has gone in and tried to really work to figure out root causes and think about this. But at the end of the day, our staff, they need they need to have their needs met. Mm-hmm. They're dealing with very complex situations. And now that I'm seeing the whole state instead of just Southeast Louisiana or Baton Rouge, because I've worked in Baton Rouge too, I'm seeing that it's not alone to this area, but it's plaguing this area more than, because what you have is 3 offices in the region, 1 large with a high volume. And so, one of the things that Kim did when she first before her first week to start was she started making contact with the Children's Advocacy Center, law enforcement, all those people, the district attorney's office, to go ahead and let the stakeholders know I'm going to be here I'm going to be working with you. If you have issues, could you just go ahead and let me know so I can then funnel them and handle them? We've also taken where we have vacancies in units, which I know many of the supervisors are not happy about this, but let's say we had 6 supervisors in the CPS program. Well, right now, because of the number of active employees we have there, we don't need 6 supervisors there, but we do need people to go out and do the work. So they're temporarily, detailed down to go out and work, or no cut and pay, none of that. They're going out and working cases for a temporary period of time while we get staff on board. Then their units will be formed, and then hopefully those staff will be able to come in and you'll be seeing, fewer backlog, fewer abandoned cases, all of those things. Because historically, supervisors sometimes do carry cases and do have to work cases. And at this point, it provides them the opportunity to not have to have a supervisory role at the same time as they're trying to work the cases.
Seems like that is like a natural course. Like that sounds like that should be happening anyway. That should be happening anyway. That sounds like it's a natural course of what should be happening if you don't have that many people. I'm still trying to wrap my mind around, how is it that you guys have managed to get New Orleans, I would say, like under control? Because when I first started here, I know that Baton Rouge, New Orleans, and Alexandria were all at the heightened level, right? And they had all of these cases. You have managed to be able to seem like address the issue with Alexandria, address the issue with New Orleans, but we have not been able to, or Orleans, we have not been able to address the issue right here in the capital city.
There's been several leadership changes over the years, and in that office, as far as the area director goes, who's over the entire region, there's been some changes in that. There's also been, we've had changes in administration too, so it's kind of like figuring out how do we, in New Orleans, we had a stable area director that was in place and all those things.
Okay.
So, but the only reason that we're left here with Baton Rouge and the other places are, is the other regions didn't have the backlog that Orleans and Baton Rouge had. Mm-hmm. That project was done specifically to look at actually Jefferson Parish, not even the whole Orleans region. And then they decided to do the whole Orleans region, which was very effective. And so now we know if we can do that, and we can do it effectively with the proper support. Kim can't just send out an email saying, y'all are to follow the staffing directive and do this and that work. We have to actually be able to have the people to come in and support the supervisors a little bit, and that's going to take pulling in some consultants from other areas and different things to help. But at the end of that, I feel like we'll be looking at a different picture in a few months. And hopefully
in 6 more months?
In a few months, I'm saying. In a few months, like we'll be seeing progress. Orleans, it didn't happen overnight. It was, their backlog was up to, I want to say, around 600 last year. And so that being down to 1, it does take time, and you also don't want to close cases that shouldn't be closed. Some of them need to be revisited. Some people walk out the door and leave all their cases on the desk with nothing in them.
Yeah,
that happens.
So, Ms. Kim.
Yes, ma'am.
If you could right now today, and I don't want to say make a wish, but if you could have your one desired answer as it relates to the department, what would it be? Because I'm very concerned about this as I listen, and it seemed like we've been able to address other regions of the state, but right here in the capital city, we have not. And we have some of the most critical cases I've heard, and unfortunately, horrible death.
Yeah, you're right. and you're like dangling a bibbity bobbity boo stick in front of me, right? Like if I could just fix it. I have to be very careful how I answer that because I don't want you to take it the wrong
Okay.
way. But I would have appropriate staffing, not just in numbers, but in ability and knowledge. And as I identify staffing, ability, and knowledge in my current state, and I try to teach and mentor and mold, not just at the field, not just the workers, but my supervisors and my managers as well. You know, there are areas that they are growing still too. There are areas that I'm growing still every day. I don't have enough time because of the volume to give them what they need. And so when I say appropriate staffing, it's two-edged. It's numbers and ability.
I think that's a fair answer. I think that was a very good answer. I guess my only question would be is how we get there, right? Because it's almost what comes first, the chicken or the egg? Because it's a constant battle. And I know there's been many things that we have done throughout the years to try to address it, right? In terms of trying to do this pay, trying to do things that we've done with civil service, to do different incentives to help people to be able to come and do the work. But it's still, somehow we managed to do it in other areas, but we have not been able to do it here in EBR. And that is very concerning.
I think what you're going to see, and I said this to this team when they asked me to accept this position that I had applied for, I said to them that I don't know that I have all the answers or that I am the answer, but I'm going to dang give it a try because this community and these staff deserve to work in a family-like environment. And that environment is something that I am working very hard on in all of my offices, to teach them that it doesn't matter if you wouldn't look at them a second time outside the fence, but inside the fence, they only look as good as you make them look, right? And so your win is their win, not your win is your win. Everybody wins together. And that's something that we are trying to really grow in our office, is making sure that I'm not the only person winning, but if I see my coworker sitting next to me struggling, lean down and ask how I can help, because if we can't do it together, we can't do it at all.
What is it that you need now? Is there anything that you need now that you don't have?
Staff.
Outside of staff? Anything else?
I have identified training areas for the staff that I have that need to be revisited, and we're working on that.
Okay. Thank you. Thank you, Madam Chair.
Senator Mizell for a question.
Thank you, ma'am. I don't know who wants it, but I'm listening, and I can't help but notice that you started the end of April. Everybody, when I get emails from a lot of DCFS employees, you have the burden, the incredible burden of what you're doing for children. But then the majority of emails I get from employees are inner office displeasure. Okay? So when and I'm assuming you're there late spring to address the inner office displeasure. Okay? So when these people leave, are they having an exit interview? Does somebody get, like, I don't mean check 3 boxes. I mean like a deep dive into what was your source of displeasure? What could we have done better so we don't keep losing people? Because it seems it's the people with the most experience who maybe expected more from the workplace or weren't getting the support they need to get. But I don't want to read, I could be totally wrong. But we got to figure this out so we don't keep losing good people.
That is exactly something, Senator Mizell, that I've been trying to figure out, is they do get the opportunity not to speak to me on what displeasures them, because I do recognize in my position and some of the decisions that I have to make, they may not like those decisions, but that's just the nature of it. Everybody has a boss, and sometimes we have to just say yes, ma'am, and do what we're asked to do, right? But they are given the opportunity to speak to someone and tell them, this is why I'm leaving. The majority of it is unrealistic expectations is what I'm hearing. One of the other things, and
On
it's
which end? Are they expecting too much, or are y'all expecting too much? Who's expecting too much?
I think it's probably both. I think, and I have said it from the time that I started with this agency, that the person that hired me did a fine job of color coding the job that I was accepting, because it wasn't anything like what I envisioned or got from my interview. And so one thing that anybody that you talk to that works with me will tell you is I am as transparent comes. I'm going to tell you, great job, but I'm also going to tell you if you made a bad decision. And so I don't know, because I didn't work with the previous leadership that was in this office or these offices. I don't know that they've ever had anybody directly in the last 3 or 4 years say those things to them. The most experienced CPS worker that I have has less than 2 years with the department. And so when you take that information at 2 years, 20 years ago, I would have never have been assigned the types of cases that our workers get assigned now. You're just getting comfortable with your allegations and what they mean and how to identify that. But at 2 years now, you're working fentanyl, you're working sex trafficking, you're working gunshot wounds, you're working babies that are beat to death. And so when you try to get a hold of that, and I could say just this to them in the interview, just what I just told you, Senator Mizell, they would probably still accept the job because they don't know how often that happens now. But then when the reality gets into the work of it, it's not what they thought it was going to be. It's maybe harder than they thought it was going to be. There's more of it than they thought it was going to be. And so I think you're seeing displeasure on both sides, unrealistic expectations on what they thought it was going to be, and unrealistic expectations of the magnitude of work that we have no control over.
Right. And to that point on your work, I don't know what the division of job roles are, but my first thought is, oh my goodness, if they get a high priority, that child needs somebody to go out and look at their situation. So do you all prioritize those hotline calls that are kind of warning calls about the condition of a child?
So the local offices, the field offices, get assigned the case. So the hotline says this is a priority one,
Right.
a priority two,
Right.
those types of things. When it comes down to us and we assign it, we tell them, you have this case, contact is due within 24 hours, within 48 hours, within 72 hours. And in those timeframes, we are juggling the other cases that come
Yeah,
in.
that's what I wondered, what your priority
Yeah,
was.
Baton Rouge on average accepts 350 new reports every month.
350 new reports.
New reports every month.
And that comes from any assortment of
Any
ways.
assortment. And that doesn't take into account the additional information reports that we may get on a case that we already have open that requires us to go back out and re-interview the family, mandates us to go back out. And so you may have a case and you've had it for 10 or 12 days, you've got everything done, everything seems okay, but then you got 2 P1s and one of them is a fatality and this one gets set down because everybody is safe. And so now you're focusing on these children that are not safe, and then 4 more came in, and then 2 people resigned, and it's like a hamster in a wheel and trying to balance it and make it all work within the time frames that we have. I mean, I never really thought I knew what my parents meant when they said there's not enough hours in the day, but there is not enough hours in the day for the amount of work that DCFS has, or that law enforcement has, or that our medical has. We're engaging with the same community, the same families, and there's just not enough time to do it.
Well, thank you. Thank you for coming here, and kind of, it helps us. It really helps us to see the reality of what you're up against.
I appreciate
But, I mean, we all want better outcomes than what we're living with right now. So I would hope that your input is going to make a difference in keeping people less unhappy in the workplace, and we can go from there. But thank you, Madam Chairman.
Representative Carver for a question.
Thank you, Madam Chair. I appreciate it. And Ms. Lyons, good to see you. Thank you for being here. Thank you, Ms. Shashery. Thank you both for your candor. We're asking questions not because we're trying to put you on trial. We are your partners. And I look around at my colleagues at this table, and every single one of us have been efforting over the last few years to help get the resources that this department needs for the work that you do. And all of us recognize, I think, all three senators who asked questions before me spoke about the difficulty of this work, but also how serious it is. And so that's going to be my line of questioning. Ms. Lyons, you were talking about it, and I kind of wondered if you had to pick between the two. Is the issue with staff training or quality?
Well, it's hard to know. I mean, we have training that we provide to staff. However, most of the training that our workers receive should be one-on-one from their supervisors.
Mm-hmm.
So that's where I said I thought that, this staffing model was pretty helpful. It was helpful along with the leadership in New Orleans getting behind it and engaging in it, because our staff go to new worker training, and I used to be an on-the-job trainer in Baton Rouge, so I went out with the new workers and would train them. They get the training at their new worker orientation, but it's orientation.
Yeah, it's not the same as having to walk through a
Correct.
real life experience.
When you're actually doing the work, having somebody there with you or having a supervisor who's supportive of you and calling on you and all those things. So I think it's half and half. Some of it is quality staff, some of it is training. And we can train all day long, but if we don't have somebody following up and explaining, because no two situations in child welfare are alike.
Sure.
We used to talk about that on the hotline when I managed the hotline. Was the workers would say, but help me understand, Leslie, why this was this and that was that. And I would say, well, are they identical? Because we're dealing with people.
Yeah.
So I think that it's a lot about maybe a little bit of both: support, training, quality, people who get here and understand and are committed, because it is not for the weak.
Yeah, it's definitely the deep end of the pool. But I think about recruiting for this work, and there are lots of people who don't have a social worker degree per se, but who've worked with children in their past, right? Maybe it's a retired pediatric nurse or a retired teacher who care deeply about children, and can we train them? Do we have the quality training in place to make them efficient to address what is an obvious need, especially in the Baton Rouge region office right now? And
absolutely.
That's why I wonder if we shouldn't expand the quality. Or to address that quality issue, expand some of the requirements in the hiring that we're doing. So
our hiring is already expanded. You do not have to have a social work degree, and we have taken on new recruitment type activities to try to recruit people from various backgrounds, because we know that we all bring different skills to the job. I came to this agency with a criminal justice degree. My bachelor's was, and I thought I was going to work for probation and parole, and somebody said, go see the lady over at the child welfare office. I'm here 29 years later, but I was able to get my master's while in social work while working for the agency, and I think that helped me. But I do believe we have nurses, school teachers, retired law enforcement different
too, yeah.
types of people who come to work for us. honestly, some of the, now, this was back when we had a degree requirement, but a lot of the people who've worked really well for us have been people who've worked in high-volume waitress situations because they have to work with difficult people sometimes or nice
Yeah,
people.
sure.
And they have to go from table to table and try to please
Situation to
everybody while
situation.
getting the
Sure.
work done.
Sure.
So we have.
My second question kind of came to me with Ms. Shastri's comment about like the hamster wheel. I think the only way to address that, and I know it's not simple, but the only way to address that is in a surge kind of mentality, right? Like we have to surge resources to that capital region office to stabilize it. And you have to do that before you can start focusing on training and things that are not a life and death issue on a day-by-day basis. So talk to me about how we would surge resources to the capital region. I'm thinking, Lafayette's within an hour's drive, the North Shore's within an hour's drive, New Orleans is within an hour's drive. Are there resources from other regions that we could surge into the capital in order to get it stable?
And we've been looking at that, and we've also been trying to figure out, we would like, you want to surge, but you also don't want to cause harm to another area that's just becoming stabilized. So that's part of looking at the backlog and having various people from other offices help review those cases and do some work on those cases. And in addition to that, bring in some additional people to help us get this staffing plan in place to help supervisors get used to staffing, at a certain time every week and providing that guidance and having some influence. So bringing in different people to help without bringing in honestly, we brought in teams before, and we might get stabilized temporarily, but we don't stay there. And we need to do something that's going to last longer than 60 days.
Gotcha. And this may be a question for the secretary. Does your department have enough money to meet the people requirement that you obviously have right now?
Yes. And to Leslie's point, we did look a lot at we spent, I don't know how many days in the office where we had the regional administrators from the entire state, and it was an all hands on deck. How do we help Baton Rouge not to just temporarily improve, but it has to be sustainable? And we went through everything that has historically been done, what the results of it were, what impact it had on other regions in the state. And, we kind of had an idea that we went in with as to what we would do. And then the team decided on something that was quite different. But I'm supportive of the team and believe that the plan that they have in place to model best practices from all of the other areas in the state is going to produce what we need.
Right. So just to be clear, it's not a funding or an appropriation issue. The positions are funded, they just may not be filled.
That's correct.
All right. And we have that identified, like the number, going back to Senator Pro Tem Barrow's kind of magic wand thought, like if we could wave the wand, we know right now we want 7 of these, 13 of these, 11 of those, and they're all funded?
Yeah, and we've been running the data to look at the last 12 months trend. What do caseloads look like today, including backlog? What would caseloads look like today without backlog? And then what does everything look like today based on current staffed positions, and what would it look like if we had all of our positions filled?
Great.
And based on those numbers, if our positions were filled and the backlog was gone, the Child Welfare League of America says that the caseload ratio should be 10, and we would be at that number on a monthly basis. The only area that we would need to make adjustment would actually be in New Orleans. They would be at 12.
All right. Can you provide those numbers for the members of this committee?
Yeah.
Just so we can see. I'd like to
I
do that
wanna
for
add
follow-up
that
in the future.
We also, with the second shift supervisors coming on, we also added 2 additional second shift positions to that. So it is going to be more robust and help us, I think, maintain staff on that second shift.
Okay. Thank you all. Thank you, Madam Chair.
Thank you, Senator Barrow, for a question.
No.
Oh, you were number one, Senator McMath.
Okay. I just clicked mine.
Oh, I thought you've been on the whole time.
Nope.
Okay.
Go ahead.
Senator McMath for a question. He has on his nice glasses. Let him go.
Just my gas station readers. Madam Secretary, this is just an example of, we talk about the input that we receive from constituents and current or former employees at DCFS. This is just an email that I received just while are sitting in this hearing. I want to read it to you and then just ask for your comment. I'm tuned in. I'm not going to provide the name. I'm tuned into the public meeting today for DCFS. There's a concern that 100 state office staff were moved back to the field to do case management. First of all, is that accurate?
Yes, the consultants moved from state office to the regional offices, yes.
Just the consultants?
Yes.
I'm sorry, what was the question? She was saying she's a product
I'm
of
a
that.
product of the staff that were moved from state office back to the field. I was one of those staff that were affected by that.
Okay.
In October of last year, I was detailed down from my manager 2 position to a worker in the field. I mean, and I've told Secretary Harris this, like, ouch, it hurt. But I decided that I was not going to let that be what made or break me. Mm-hmm. And I decided that there were other positions that had openings that could benefit from my knowledge and my skill. And I applied, and I sit here today as an area director. I'm a product of those staff that were affected by that. I have told all of my staff that I work with every day, I know what you're feeling. I have lived it with you. It's hard. The decisions that are being made affect all of us, not just one of us, but we don't know the bigger picture that is being looked at. We only know our piece of the picture.
Okay. Yeah, I'm sorry. You referred to the folks that were moved out of the state office as consultants. You're not considered.
I was an outlier. I think there may have been 1 or 2 of us that were higher than a consultant level, and I was one of them.
Okay. I'm going to go on. The group of employees have worked case management for 10 or more years and have been promoted to state office, similar to what your situation was, I'd imagine, right? Some of our positions at state office have been reposted for hire. Instead of bringing back the staff who've been successful in these positions, they are filling these positions with staff from LDH or hiring applicants without child welfare experience. These positions should be given back to staff who are permanent in these positions. Do you have any can you comment on that? And if you don't,
Yes,
that's fine.
so the positions that are being posted are in planning and programs. So after we did the restructure, we took individuals who had the expertise in direct casework, and they were asked to help with the regional offices. So we moved the positions around. No one took a cut in pay, but we did reallocate where those positions were to make sure that we were appropriately serving children and families.
okay.
The restructure that we put into place, again, reorganizes the work so that we have very clear lines of accountability. There are positions, they may have the same job title, but the duties within that job are very different. So, for example, we put one position in medical operations, and their role is to review denied claims by Medicaid, because we hear a lot from foster parents where they are trying to get services for their children that are in their care. Claims are being denied. We look and believe that they should be approved, and so we needed somebody with very specific expertise to look at denied claims from a LDH system perspective and help to get those approved so that our children can get the care they need. So
So in that case, you wouldn't have to necessarily have child welfare experience, is what you're saying?
yes, and there would be a number of positions that I would say don't necessarily need child welfare experience. We need to pull individuals with other skill sets. So I'll go back to call center. We have a lot of individuals that understand child welfare, but we did not have anybody with call center expertise. And Lacey would say the same thing. We still talk to her, but we needed somebody that understands how an emergency operations call center is supposed to work. How do you understand call volumes? How do you understand workforce management? And so we're looking for very specific skill sets that help us to move child welfare forward. But I would encourage anyone who sees a position and they read the description and they're interested in that new body of work to apply. And we are always going to hire the best candidate.
Would you say that I guess, what percentage of state office positions would not require child welfare work or child welfare experience?
It's a low percentage, but I can look into that number for you.
Okay, I mean, because now if you're talking about moving, and I guess that number's accurate. I believe you said it was 100 employees. The percentage of that number with not needing child welfare experience being low, so let's call it 20%. I'm just making that up. It's not necessarily no number. But you still have 80% of those folks that are working in the state office needing child welfare experience, and it sounds like the folks that are being brought on don't have that experience. Does that make sense?
Yeah, and the only individuals that we're bringing on that don't have child welfare experience is because we have identified a very specific gap that we need to get. Another example I would say is in our clinical teams. So we need registered nurses, behavioral health specialists, and we would like them to have been involved previously with individuals or children in foster care or with child welfare, but the primary expertise that we're looking to bring on board is individuals with behavioral health experience or a registered nurse.
Okay, so are you saying that it actually is it's not a low number that wouldn't need the child welfare experience?
It is still a low number. I can look at the number of positions that we converted and get that back to you. It is not near 100. It's nowhere near 100. We took those individuals and put them closer to the work serving children and families. It's a small number of positions.
And I can appreciate I guess the thought process there of putting people back in the field that have field experience. I mean, I understand that. I just want to make sure that the positions that they left from state office are being filled with, again, qualified individuals. So, okay. That's all I have for now.
So I'm going to kind of follow up just a little bit on that as it relates to, I guess, the level of experience, especially for EBR. What percentage of those individuals that are currently in EBR don't have a college degree? They may just have their high school diploma.
I think we would have to get back to you on that.
So do we have, let me ask this question, and let me ask it this way. Do we have more in this region who may just only have a high school diploma versus a college degree?
I don't believe that we do, but we would have to look. And I know that, many of the people who are, who've been with us, the supervisors and managers, many of those have masters in social work, like they're higher, whatever. But at the worker level, we would need to get back with you.
There was a restructuring about a year or so ago where I think individuals came in that did not require them to have a college degree. Do we have a higher percentage of them in this region than in any other part of the state?
civil service rules changed.
Yes.
Where they eliminated the need for a college degree and replaced it with years of work experience. But that's an interesting question we have not looked at. So we'll go look at that data and share it back with you. How many individuals with college degrees prior to the change in civil service and how many after? It'd be about a year's worth of data. It's an
Okay.
interesting question.
And that happened within the last year or so, right?
That was no,
2
that
years.
was prior to this change in the governor. That occurred in maybe 22, possibly in
During COVID?
22.
After
Secretary
COVID?
Ricks was our secretary at that time
Okay.
when that was changed, to try to hire people who had lived experience versus degrees. And at that time, we also had a high vacancy, rate, and
That you were trying to address, correct?
And we were having hiring fairs and all kinds
I remember
of stuff.
that now.
And I think, the other thing that happened from that is, not that you asked me, but we had all these hiring fairs and we did quick interviews with people.
remember
We
that
did,
now.
and so we ended up getting a lot of people that were not a good fit for the agency, and who didn't have a real they don't have an understanding of the job when they go to work there. I didn't have an understanding of the job probably until I'd been there for a while, but so we've realized that the hiring fairs and all of those things, really were not effective because we need more time to talk to people and help them understand what the job really means as much as possible.
And I know that having a degree is important, but also having the heart and the compassion to do the job, I think, is more important. But at the same time, I was just trying to equate at what time that happened. I kind of remember that with Secretary Ricks, but it seemed like there may have been more tools, and I'm not sure, seemed like they had during that time. My next question would be regarding cases in New Orleans. I'm going back to this because it's hard for me to really wrap my mind around and get my heart around the fact that we have superseded New Orleans. I mean, and so what did they do different, and what are we not doing that we need to do? I'm very bothered by that, as y'all can tell.
I know.
And I know that we are the capital city. What is it that we need to do differently that we have not done to be able to master this?
So I think there's, I'm going to keep going back to, it's not only the staffing project, it's the staff and, commitment and training, but the staffing project, because it was a leadership growth project for some people who worked for the department, they were taking this on as extra. So when they committed to be a part of the Lean Six Sigma training program,
What's the name of the program again?
Lean Six Sigma. I didn't go through it, you can tell, because I can't even say it properly. But I do know that the product was great. And so part of it wasn't a quick thing. They met with several staff from within the region at different levels. They talked about what is preventing you from getting the work done, what is preventing you from getting cases closed. They drew fishbone diagrams. They did a whole lot of work. There were 2 individuals that were overseeing it, and I was their sponsor. So I would meet with them weekly, and we would talk about what they were learning, what were some barriers, what some things we could take out, what are some things we can do differently. And then at the end of it all, we decided what we kind of hypothesized might be the problem. Supervisors aren't regularly meeting and staffing with their workers, which prevents cases from getting what they need done in a timely manner. So, for example, we're supposed to make a finding on a case in 30 days and close it within 60. If you staff the case briefly in the midst of 4 other phone calls with that worker, and then you don't talk to them again about it until the 29th day, and at that point you tell them, you need to call the pediatrician and get the medical records.
Right.
That's putting that case over the line, which then puts more. So it was that you staff that case before 25 days. If at 30 it can't get closed, it elevates, the manager has to involve the staff, and then it elevates the area director. So involving all those leadership roles and also workers knowing, I'm going to get ahead of my stuff, and learning what to expect and what to need, because you're teaching during those staffings about, now I'm going to ask this because this is this type of case. Let's look at this. So it was an experience in oversight and expectations that we have for our supervisors, managers, and there were reports created where they could look at their workers' cases and see how many days old there were for every unit. They had those reports to pull up. So in my mind, we're hiring a lot of new people all at once. And I've already asked one of the two people who created this project or worked on this project to meet so that we can work on getting a team together with some of the people also from New Orleans to say, hey, we did it and it worked. And if it worked for us, it can work for you. So to help get buy-in, I think that staff leave because they have a lot of work to do. They leave, but sometimes it's because they're not getting the guidance they need, and sometimes it's because that supervisor doesn't know how to set a parameter and say, during this hour, this day, my time belongs to Senator Barrow. So if it's an emergency, could you please call Kim Sashery? I need this hour with you so we can go over your cases uninterrupted. And it's helping them set those parameters and know that this is what we need to do, because every case has a child or more than one child, and we need to make sure we're doing everything we need to do to keep that child safe. So that's a long answer, but I think if we can get the people hired, the staffing in, and provide some wraparound support to our staff and help with the office culture too, so that people feel that they are cared about, that we understand it's a hard job, and that we can make a change, we can make a difference. There's a lot of good people there.
I believe that. As a matter of fact, I believe that the people that go into this arena are good people because they want to see and make a difference. There may be a percentage of them that, are not as committed, but I believe that most of the people that go into this arena, most of it is tied to something personal to them. So they want to make a difference because they don't want a child to go through what they have been through. That's what I believe. However, I think about some of the conversations that I have been a part of for a long time. I've been a part of the Department of Children and Family Services since I've been elected. Prior to being elected, I worked for a counselor who actually saw children who were in the department. So I have seen the good, the bad, and the ugly, the extreme ugly, right? I guess I'm just still trying to figure out what is it. And I know that, you can never pay the people that work here enough. I don't think you could ever pay them enough. They have to be what I consider called to do this work. But there's still something really missing, especially when I look at the Baton Rouge region, trying to figure out what is it and how is it that we have not been able to wrap our hand around this issue a little bit better. Maybe y'all have did it a little bit better, but it's not showing because we're still losing way too many kids. And so I hear you, I hear your heart. I hear the words that you're saying, but I can also read your body language. And so I'm reading your heart. So I know your commitment to this issue. But I am still wondering what else do we need to do, because I'm going to tell you, I'm deeply saddened as every time, and I don't know what it is to now, I think I'm getting more alerts on my phone, not from my office, Because y'all are calling my office, and every time I get that call, my heart sinks a little bit more, but I'm seeing more alerts, even with the near fatalities that we are seeing. And I know that our environment has changed a lot, right? You guys are seeing a lot more complex cases than you saw 10 years ago, probably even a year ago. But what more do we need to do? Because what we're doing right now is just not working. And the fact that we have seemingly, according to some of the information I've gotten, more, how I want to say this. I know that we have higher case volume in Baton Rouge, but the people that were working the cases, I don't know what the qualifications are of those individuals. So what does that mean for this region where we need to make sure that we have all hands on deck, right? We need to have the individuals who are familiar, they know the ins and outs, and et cetera, work in these cases. What more do we need to be doing? I mean, how does that need to look?
I think one thing is, and I know the Secretary and Dr. Hook are going to talk about it, but we're hiring a nurse for each region, and that is going to help us tremendously because a lot of what we see, some of these more complex cases, you have a physician who's talking to a person or one of our workers, and they're not speaking the same language, right?
Gotcha.
So Dr. Hook has been a tremendous asset to this department because if the hospital has a concern that we're not getting it, then they're communicating with her, and then we're looking at it and saying, the other piece is that, and I didn't say this earlier, but critical thinking is something that, when we're able to look at our phones and get an answer or go to ChatGPT, it kind of helps it hinders critical thinking. And I've been around Baton Rouge off and on since 2016 was when I first went over to work. I went over from Washington Parish, so I was in Covington region. So I was in a different world. I said, these people work all the time, like they're working 24/7, and I recognized the difference in not only did you have the work, you had the work ethic, but the work was overwhelming. So you're right, we do have to do something different. And we've sent teams in, we've done all that. So that's why I said it has to be different. But we've got to help think about teaching critical thinking and not presuming that that our staff have that. You're looking at somebody who had to carry around quarters with her. If I got in trouble, I had to call the sheriff's department from a payphone. And we had to read maps, and we had to do all those things. Child welfare work was different then. Now it's modernized, but at the same time that it's modernized, we're still in the people business. So we have to be able to talk to people, gather information, digest it, understand it, and be able to repeat it back to somebody to where we can get the effect we need to keep children safe. So I believe that child welfare oversight and supervision is a little bit more complicated than it used to be because we're having to say, sometimes you have to be nosy. Sometimes you have to ask that extra question. What would the next logical question be? I think that's where the law enforcement liaison will come in and help us some. We've got nurses, that are going to be coming. We've got Dr. Hook. And we are trying to leverage every available resource we have to make this place better. A lot of those kids, we may not have known, or they might not have come to our attention before we got involved. But every week when we review fatalities, we're talking about those things. This child never came to our attention, but should this child have come to our attention from another way? So we are looking at that, and we want to make a change because we know the status quo is not acceptable. It's just not.
So going back to the law enforcement liaison, how is he working with you guys? Have y'all started to interact at all yet?
I've been interacting with him on different situations where we might have had I mean, this is just an example, and this is something I know that's been a concern of yours, where you might have a situation that occurred, but you don't know what parish it occurred in. So if you call one law enforcement agency, they might say, well, we're not going to handle it, or the other one. So he has helped with that.
Okay.
Those kind of situations. He has met with the regional administrators to talk about, what his role and introduce himself to everybody. So he's doing those kind of things. Like right now, he's getting, I think, all the stuff off the ground to do the things that he plans to do. Meanwhile, we're calling him as issues arise and engaging him to help us sort out whatever that might be.
Okay. Are you finding that to be helpful?
Yes, it's helpful. It's
Okay.
very helpful.
All right. Thank you, Madam Chairwoman. Thank you.
Thank you. What about your support staff? Do you have sufficient support staff?
I do have openings for support staff in my office, admin support staff, as well as team specialist support staff, which are those staff identified to help our field workers, our caseworkers, pick up medical records and fax off requests and, those types of things. One thing that is big in the Baton Rouge region, and you wouldn't think it would be this big because we have public transportation, but the number of citizens in Baton Rouge that don't have transportation and then don't have access to the public transportation is big. And so we try to fill that gap and making sure that they get to their services and things like that. But what we have recognized is, and I don't know if they recognized this before I got there or after I got there, but what we have recognized is they may not have the funds to buy a bus pass, so we buy a bus pass, but then they sell their bus pass. And so we're back to the square root of nothing, because what we did to try to assist with the need has now been undone, and so there are quite a bit of challenges that we face on that. I could use more admin help in the office, support staff in the office, but I don't know a region in this state that wouldn't answer the question the same way.
Thank you. And the board is clear. We were on item where we were talking about the Baton Rouge. Is there any testimony on cards from the regarding the Baton Rouge office in specific? Yes, ma'am. Do I have a card from you? If so, just give me your name and. Hold on one second.
Tony.
Hello.
Yes,
My
ma'am.
name is Ann Spink.
Okay, let me find that card, please. Okay, I have it. Yes, ma'am.
I was an
And
original
then, hold on
member.
one second. I think we have someone else. What's your name, ma'am? Ma'am?
Lindsay Mothershay.
I was an
have
ori-
other stuff to say, but I do want to mention something.
Okay, I'll keep you in queue for the rest.
Mine is specifically about what they were just talking about.
Okay, so we're only specifically on Baton Rouge?
Yes.
Okay, great.
Okay, well, they were talking about training. I was an original member of the Pelican Board, which started, I think it was 15 years ago, I don't know. And I was also working with the Child Institute, training from the social work in Southeastern. And my question was, our goal back then was to develop lots of training that would actually become videoized, video training for the Department of DCFS. And I'm just curious, is the School of Social Working still producing and helping y'all with training? And is the Pelican Board still behind that? Okay, well, that was just my question, because I just know they were such a valuable source with training in ancient days when I was a foster parent. Oh, Lacey Sims asked me to be a foster parent. Mr. McMath? Lacey Sims asked me to be a foster parent. And Tony put one of my first placements in my home. So.
Tony is my nickname.
Yeah,
Sorry,
she's
guys.
Ashby. Kim also knows Tony's. All right, that's all I had to say. I was just curious about if they were still being utilized.
Yes.
Yeah.
Okay. Yes, ma'am, I apologize. State your name for the record.
Lindsay Mothershed, and I have other stuff regarding everything else later, but I wanted to speak briefly on the backlog issues in Baton Rouge. So we are Covington Region foster parents, but we live in Baton Rouge Region. We live in Clinton, and apparently Baton Rouge Region and Covington Region have agreed to have joint custody of our home, so we take cases from both regions. We have adopted 3 children from other regions and parishes, and I can see the significant issue with the way policies go and the way the timelines go in Baton Rouge versus other parishes. In every other region we've adopted from, permanency hearing happens at 12-month permanency mark. Then it's TPR is filed within 30 days. Then you have a TPR pretrial. Then you have a TPR hearing, and then adoption. And it all happens within a 3 to 4 month period. I have sent several emails to Ms. Kim.
You have?
I have, and haven't had a resolution so far. So one of my issues is with reimbursements. I have mileage reimbursements that have not been paid since December of 2025. They owe me over $1,500 in mileage, and now they're taking mileage away. And also with the cases,
Is this you?
yes, that's me.
I actually have responded to you. Yes.
That one, but you didn't respond to the second one, and I'll get into that in a minute. We also have a case, and I'm going to try to be very generic with our case situation. We have a Baton Rouge case with twins who have severe disabilities. Case was, we received the case in December 2024. The goal was changed in December 2025 to adoptions. We are now at the 20-month case mark with no TPR filed on the twins. The DCFS attorneys are stating that they are overloaded with cases right now, and they are not in a position to file for termination. So these severely disabled children who are sitting in my care for 20 months with no parental case plan compliance whatsoever, and nothing is being done to progress the case at all.
So I can elaborate on some of that for you. Actually, I reached out to Miss Lindsay after she made a post on Facebook and elicited my contact information to her to help her with what she was looking for in regards to her mileage reimbursements. The other case that she mentioned, I did take some action on it and try to get some things going, but there are some judicial things happening in that case that I don't have a full grasp or an understanding of, that I'm trying to get some answers on. Something with an appeal or something being filed in the First Circuit Court of Appeals.
The appeal was denied.
And so we're trying to go back and figure out how to posture and what needs to be done on that case so that we can get it moving forward. It's not that we're not trying to move it forward, it's that we're trying to make sure that we judicially take the appropriate steps to ensure that the finality of the decision that is made on that case is the appropriate and right decision and isn't made out of a judicial process that wasn't followed correctly.
Thank you. And I know you guys cannot discuss specific cases, so I'm going to remind everyone here in committee, specific cases legally cannot be discussed before this committee. We can speak on general matters, but we cannot speak on specific cases. If there is a specific case issue, of course, you can kind of talk around what the issue is, like not a callback or, delayed, whatever, but not that specific case. We are not attempting to impact negatively any private information.
My main issue is following timelines. Like, we're 20 months into this case, and we're still just sitting at we have a status hearing tomorrow morning, and we're still just sitting.
Is that
there.
in court?
Yes.
Okay, so yeah, that's going to be a legal matter. And specifically, what timelines are you? Let's not talk about the case. What timelines are
I
you
have been
concerned
told
about?
that if I want this case to move forward, I
Let's
need to
not talk
hire
about the case.
a private attorney.
Let's not talk about the case.
Okay.
Let's talk about the specific timelines that you're concerned about. I want to stay within the rules of the committee, and I want to help everyone. Ms. Kim is probably going to make herself available, I'm sure. I'm going to ask Sergeant Orms if you want to talk about the specifics of a case to escort you down if she has time to my office so you can privately discuss that with her in a proper setting. What the committee can discuss is specific timeline issues you have, not with the case, but just this is not done in time, this is not.
A TPR should have been filed by the 15-month mark. If the
Which one?
A TPR should have been filed by the 15-month mark.
TPR? I can't hear you.
Termination of parental rights.
TPR, no parental rights, yeah.
The goal was changed to adoption in December. A TPR should be filed by 15 months.
Okay.
There is, I can't. never
About
mind.
15 months?
Yes,
Okay. What else is it? What are the timelines?
that's it. We're 20 months into this case. There should be no reason these children are still in state custody.
Okay. So we're not going to talk about a specific
Sorry.
case. What I'm going to...
It's hard to discuss timelines when I can't.
Well, you could
tell
say
you.
that we, it's taking generally 20-plus months,
Yes.
Yeah. So what I'm going to do is, the board is not clear. There's a question for Ms. Kim.
Yeah, well, it was on.
Go ahead. I
On the
apologize.
transportation, I know we were going to get to that, but you're here and it was brought up. I was wondering if we could talk about the reimbursements for foster care.
I have a whole lot more to say about that if you want to wait. But yeah, we can,
If I may add this real fast, Senator Math, our Bureau of General Counsel is coming so that she can sit with Ms. Lindsay and talk to her specifically.
On her
about
case?
it. On
Yeah,
her
and I'm not
case.
trying to talk
Just
about
so
that. I
y'all
agree with the
know.
Madam Chairwoman, and I was going to dig in because transportation and some of these reimbursements were brought up for foster care. If I could get the secretary to come back up, Ms. Harris, if you don't mind. And correct me if I say something that is not accurate, please. It is my understanding that transportation for things like doctor's visits, schools, and visitation have been, I guess, reimbursement for those has ended. You want to wait until?
Until we get to foster care.
Okay.
Yeah, there are some
Never
who are
mind.
waiting on foster care because that's why we have it
Okay.
on the agenda.
Then I'll wait.
Yeah. And we thought you had some issues specific to the Baton Rouge region.
mainly the reimbursements that have not been,
Okay, so
paid
that is
since-
agenda item number 4E.
and then the case backlogs, like,
Okay.
no other parish has cases that are not following proper timelines.
So, Ms. Kim, do you have time, because we're going to get to 4E and hear from all the foster parents. Do you have time if one of the Sergeant Owens will escort you all to my office to discuss her matter so that we're not violating any privacy issues? And then, Madam, we will keep your card in queue for the foster care testimony. Thank you. Members, the board is clear. Is there anyone else? Okay, the Baton Rouge issue. We're back on what, Madam Secretary?
Backlog, which I think we can handle very quickly.
Well, we were on update on reorganization and of the department and reclassification. Do you have some comments regarding the backlog testimony?
Yes, if we go back on the presentation, that was the slide we left off on. Yeah.
I'm sorry, ma'am. Go ahead. I'm ready, yes.
Yes, sorry. So we have talked about this a bit at length and specific to Baton Rouge. So this is just a representation of what has happened with the backlog over time. And as we have talked about, the majority of this is in the Baton Rouge office. Almost all of it is in the Baton Rouge office. Let's see. Sorry, I'm getting my papers back in order. So investigations and allegations, Leslie talked about it just a little bit, but we receive investigations, which is the case, and it can have a number of allegations per individual case. We average about 3 allegations per case. So in 2025, we opened 23,077 investigations with more than 66,000 allegations across them. As a point, last session, we did report a little bit higher number of investigations in one of our committee meetings, but as we have worked the backlog, what we have found is that the investigation should not have been opened separately, but instead it was information that should have been incorporated into an active case. So as we continue to close that out, that number may fluctuate just a little bit as to the total number of investigations. For 2026, we have 15,377 investigations with 38,000 allegations. As of Friday, the total for the department, we have 4,449 investigations that are active and being worked, and that does include the 1,430 that are in backlog. The most common allegations that we see are what's driving our workload. Lack of adequate supervision is by far the most common allegation that we have, but it's most often coupled with something else. So for instance, it'll be coupled with substance use or mental health. Dependency, inadequate shelter, physical abuse, bruises, substance exposure, and medical neglect follow, but understanding what the allegations are that are coming to the department is very important for us to start putting together prevention mechanisms around them. This brings us to the third topic that we were asked to cover here today, and that is related to fatalities in calendar year 2025 and calendar year 2026. We are going to talk about this in terms of calendar year investigations, calendar year fatalities, and federal fiscal year fatalities. So the numbers may look like there is error among them, but that's because of the way that they get reported. But we believed that y'all wanted us to report to y'all on calendar year. So this slide shows investigations related to fatalities or life-threatening injuries related to children. Since 2026, or January 2026, when we receive a report of a fatality, we do call and notify Madam Senate President Pro Tem, and then the senator and representative in the district where the child has passed. We do call y'all and let y'all know of that too. In 2025,
Senator Mizell for a question.
I got to stop you on that.
Yes.
Because I was notified, and I was basically said, a child has died, period. And when my assistant's trying to find out what happened, can't tell you. Under what reason is it that I can't be informed when a child dies in my district?
there is minimal information that is supposed to be provided at the time of a child's death.
A child died. That's what I was told.
So it should include the date of birth, the area. It's 4 elements. Do you have
No.
The age, the date, the date of birth, the age of the child, and I think the location, the gender.
And what is the deadline to provide that information? At what point can I expect to see that in the notification process? Because the initial notification was, the initial notification was the child has died. Yeah.
So we can
need to
correct
correct
that because that's not what the procedure is.
Yeah.
But I think I'm sitting here and I've got 400 pieces of paper in front of me because I'm looking at every best practice between KC and the National Commission, and over and over and over, the one solid idea that gives a good outcome is data, sharing information.
Yeah.
And I know we were talking about the same thing probably, maybe you weren't even in the role, Ms. Secretary, but it's like, we've been saying this forever and ever, and it's the one incredible aspect of what could be improvement that we're so hesitant to fulfill. I mean, I'm having to add, you're telling me that's the procedure.
Yes, ma'am.
Well, I know what I'm getting at my office.
Yes, ma'am.
There's some sort of a disconnect taking place. So, I'm stopping you on that because, frankly, this is like a fairy tale unless we do it. We have to do it. We can't just keep talking about it. So that's what I'm asking you. I so just want what we put in legislation and what is already in statute and what other states are doing happening here. That's it. I think we're capable of it. So anyway, keep going. I'll try to leave you alone.
1 second, Senator McMath for a question.
No, just related to what my colleague just said, it's my understanding that, well, I completely agree. If she's right, if it's about data sharing, and this is a conversation we've had over and over and over again, and it's why we created the Office of the Ombudsman. I've said this multiple times in settings very similar to this. If you're sharing, whether it's with the Ombudsman's office or with other agencies, police, CACs, district attorneys' offices, the more transparent and the more data we can share, the more information we have. These concerns. And, every time I get I understand, get a head nod, but then something else happens to where it seems like we're not wanting to share this information. And this has just recently been brought to my attention. And correct me if I'm wrong, again, Madam Secretary, but your department has recently reinterpreted current law and is taking the position that they don't have to provide the Ombudsman's disposition information regarding child fatalities that have been substantiated by DCFS, but have not been substantiated by an examining physician. Is that accurate?
So that's not entirely accurate, but one of the things that our legal counsel has looked at is a Resolution 4656. So there is some specific language and what we can share in a summary disposition as related to that resolution, and I think it's on like 9A. But it does talk about an examining physician making that determination that the death was the result of abuse or neglect. The information of the fatality should still be reported to the Ombudsman's office. But
Is it being reported to the Ombudsman?
and it should be, and I have worked
Is it?
pretty diligently with Ombudsman's office, especially over the last several days, to make sure that the information that I have has been relayed to them. And we have committed to them, and they have committed to us, that we're going to continue to meet on an ongoing basis to make sure that our numbers are reconciled, because we want them to have all of the information that they need to have. And so, I'm sure that they would agree to that we are going to meet, we're going to reconcile those numbers. If there's numbers that they have that we don't have, we're going to make sure that they have them.
But you guys are meeting once a month anyway. Is that?
That is. We do meet once a month, but there's different topics that we address. And so we have not specifically gone case by case, and we have
Child fatalities is in like a standing agenda
we do
item
talk about
your-
it. Yes, it's a standing topic, but there are some times where, like they may bring a list and we might have a different list. And so we're trying to go through those together. Michelle and I spent a long time on Friday trying to go through the numbers and make sure that we were on the same page about what those numbers are and what they should be. And she had my commitment at that time that anything that they needed in addition, that we would be able to provide.
And I'll add to that, Senator McMath, that we have been working to build out an automated workflow. So at the time that a case is added to our system, it pulls out those elements that are required and automatically sends it over. So we don't have to wait
That's
for a
not. That's
person.
not being implemented yet, though.
I'm sorry?
Has that been implemented yet?
No, it's being built.
Okay.
It has not been implemented yet.
Any idea when we could expect that to happen?
End of the week? End of the week.
End of the week? End of this week?
Yes.
Okay. How long have we been working on that?
Since the first time we talked about sending notifications to the ombudsman.
Okay, it's been a while.
Yes, yes, it has.
All right, just so happens to be this week. That's great. Okay. Thank you. Got a thumbs up from the IT guy. I'm just going to assume I probably downgraded you. Sorry about that. I did. Explain to me, you mentioned the resolution section B. Explain to me why we can't report certain information until it's been substantiated by a physician.
So there are some protections for the parents when they're being investigated. And so, I believe I wasn't in my position when that resolution was written, so I don't know what the intent of it was at the time. But the way that it's been explained to me is that we need to make sure that until we have substantiated a finding and then, had that confirmation that we're not releasing additional information, because that does also pose a risk for us to have an appeal and an overturned finding. But, we could, I'm not a lawyer, so we would probably need to get, legal to do any type of interpretation of the law.
That was a recent resolution?
No, it is not. When I started in 2023, that was already in place, and so there was an interpretation of that law. We were providing summary dispositions, but we were waiting on confirmation from an examining physician in order for us to provide those summary dispositions. And I was involved in, many of those being sent to the ombudsman's office. I think, one of the things that has changed is we're trying to really report out any of the information that we're getting. And so we've been also reporting cases that may be, even today, we're reporting to you all cases that are substantiated but have not been even fully closed. So we have 5 of those, we have actually 6 of those cases that we'll be talking about in the data that we have a preliminary substantiation on, but those cases have not been closed, 5 of which I know the Ombudsman's office does not have because we do not have examining physician confirmation. And we've talked about that.
Okay. Excuse me. Thank you.
And it does not have to be a coroner. I just want to also put this. So if an ER physician is examining the child, diagnoses the child with non-accidental trauma, abusive head injury, that meets the criteria. So it could be as early on as the first day that we get the case, and we have that confirmation that we're able to report it out. But in some of these instances too, we may have a report that there's suspected abuse or neglect, but we don't really have a cause of death for some of the kids. And so, it could be suspected like a co-sleeping where we're not really sure exactly what happened. We have had some cases where we had what we thought was unsafe sleep, but then we've gotten the report from a coroner's office and found that actually it was methamphetamine exposure that caused that infant's death. And so then we were able to report that out, and it was a different type of report than an unsafe sleep issue.
So how do you think other states are able to do it? Do we need to change
Ours
that
is our
statute?
state law. So it is a state law. It could be changed at your will, but right now there are other states that have different laws in place for their state on what information that they can share. So we're trying to abide by what we believe the law is right now.
Because all the recommendations, whether it's the Federal Commission or groups for child safety, child protection, just letting children have some quality of life that they can live to see adulthood, they all recommend full disclosure about the circumstances involving the child's death. So it's worrisome that we're not even able to meet the guidelines recommended by the Federal Commission on for children because the statute that is only recently being interpreted the way you're interpreting it, though, isn't it?
No, it's not my understanding. I mean, when we were providing information prior to this, we were relying on that certification by an examining physician. There were cases I was involved in when I first came into my position that, we had some heated debates about whether or not it should be reported out. And sometimes I would think, hey, this to me, I know that you're saying that you can't say that this neglect caused this death. But I certainly think that this child would still be alive if this didn't occur, and it did not meet that, that burden. So those cases were not reported out at the time. We might have substantiated on something like neglect, but maybe not the death allegation.
So why do you think, I know some of the cases that are under investigation, or they haven't, we know the child has died, we are hesitant to say it was due to abuse or neglect, and it takes months and months. Why? Like right now, what's the number of children who've died this year?
So the number of children that have died total this year, as of the time we submitted this report, was 52. As of today, when we sit before you, it's 55. And those are cases that are reported to us. So there are more children that have died in the state of Louisiana. But the reports that we have received as an agency is 55 today.
55 today.
And 52 when we submitted this report.
So say that again, what you just said. There are more cases that haven't been reported.
Remember? Yes, because if you remember from the CDR, they reported, over their 2-year span that there were approximately 1,900 deaths. The agency does not receive reports of every death. We receive reports of deaths that are suspected to have occurred because of abuse or neglect. And so anytime like a child dies, we don't necessarily get a call about that. We get a call about the ones where there's concerning circumstances. And so,
because the national report I was reading said that like 75% of child deaths are not known to the protection services, are not designated. The abuse and neglect number of deaths that we have reported are not nearly what's true to the actual fatalities.
well, and I think that's probably accurate, an accurate statement. I don't know about the percentage, but I will say if you think about, too, just a couple of years ago, a lot of fentanyl deaths were not known to the agency because we weren't testing for fentanyl. And these deaths were getting coded as, sleep issues, medical issues because or unexplained deaths because the coroner's office was not routinely testing for that. We were not routinely testing for that. Every time that there is a new exposure to a child or new risk factor that we're not able to test for or to readily see, then yes, that could go unknown to the department.
So on that, over and over, just going in that direction, reading this report, over and over, it's the one under one.
Mm-hmm.
So like in the case with, did she leave, Kim, that was here from Baton Rouge, calls that come in with the child under one, are those given a higher level of response? Or
so that is part of our right response, and we have not fully, again, rolled that out, but that will be part of our right response because we've identified that as a risk factor for fatalities and near fatalities. So we know that we do have to focus our energies there, and we're really trying to focus on 3 and under. To have some increased response.
Tell me what does that mean? We're trying to focus on it. Tell me how you're trying.
I'm going to let Assistant Secretary Guillory talk a little bit more about the right response because they're working on rolling that out.
And really, my thing is the calls that when they're screened are denied investigation. Is somebody go back and look at those calls and say, oh, we have a bunch of under 1-year-olds, these are the same people, but you know what I'm saying? Is somebody connecting the dots for the long term? Because I think something's been missed.
Yeah.
For us to have 55.
And so when we talk about the right response, Senator Mizell, we're talking about the right systems, the right timing, and the right intervention. Thank you. And so what that means is that every call, someone is worried about something. They're not just calling to call.
No.
And so if that call comes in a 0 to 3 and there is a second review of that case. There will be, because we're building that out so that we can make sure. Currently, when you look at a child 0 to 12, that child is very vulnerable. And so currently those threats, when you review that, the child should, the age of the child is considered in the vulnerability of the child. So yes, we do also have and we are currently working to make sure that this is implemented across the board with the response center and with the regions. But if a call comes in and it is non-accepted at the response center level, when it reaches the parish level, it must be reviewed by the field, which is the parish and regional.
So even
offices.
if they don't accept the call as a I don't know what term you use.
Yes, ma'am.
Valid or whatever. And another thing that's recommended, I'm going to tell you this while I've got you.
Okay.
Using the same terminology between agencies. It makes me crazy when
Yeah.
you say we've got this many
You're right.
substantiated and this many
You're right.
not. And at the end of the day, it should just be one number. These are the children that have died. I mean, anyway, but yeah. So when you say that they're going to go back and look at it, they're looking at all the calls that came in that would apply to their parish, or how is that broken down?
That's in their queue. So it's all the calls that apply to their parish. So it's not just the calls that are accepted. It's those calls
All of them.
that are not accepted also. Yes, ma'am.
And with what intent? Are they going to go, what do they do with that?
The intent is to review and to ensure that if, a second eye is a great eye. It's really a great eye. And so the intent is to really assess it at your level and have a discussion. If I review a case and I believe that I have some concerns, or maybe I know the family, that information can be discussed at my parish level, and we can forward the information back to the call center. And it has been done.
Okay, I'm sorry. Did you want to, we have, the board's clear. Did you want to continue?
Yes, we can continue. And it's to exactly what you were just talking about, Senator Mizell, the children who are most at risk. So if you look at the investigations for fatalities and, Brianna. Fatalities and life-threatening injuries, our children from 0 to 3 are the most vulnerable and at risk. And I'll say, too, this is one of the reasons why Dr. Hook led the work to create the prevention partnership with Women's Hospital. Yes.
I'm sorry, but on that previous page, I just found my page on that. The firearm access, I'm going to bring that up. We talked about it earlier with the child death review panel. Have you all ever made a pitch to address that, or to make the public aware that children are dying because people are leaving their guns accessible to the child?
One of the things that I do want to say is that we have totally revamped the way that we're looking at our life-threatening injuries and fatalities. That's new work that we're doing as an agency, but then we're also working with the National Partnership for Children's Safety. And so what we're doing now is a very focused review of all of our fatalities. We were having previous to that like monthly fatality meetings where we would talk about the cases, but we really weren't pulling out like some of the data or the trends. So this is the first time that we're able to come to the table and really talk to you about this, because of the work that we're doing now, we're looking at these causes and we're able to say, this year we had 40% of our substantiated fatalities at this point are due to firearms. 40% of our substantiated cases at this time. That number may go down as we substantiate other cases for other causes, but as of today, 8 of those children are from one incident, though I do think that it's important to note that. So when we're looking at that data, that 8 of those children were involved in one incident.
Right. And that was an adult doing, but very often it's a child, hurting another child accidentally because they're just unaware of.
And this is the data that we want to bring to y'all. Like now that we are able to really focus on this, we want to be able to bring this and have these types of discussions to figure out where are additional resources needed, both from the agency, but then also from the state.
Right.
And so, every time we come to the table to talk about fatalities, we're going to be coming to tell you what we're seeing. Like what are our trends showing us? What is the data saying about these deaths?
Well, and that and the drowning as well.
Mm-hmm.
I mean,
Yep.
the children in the bathtub, all the horrible things you hear about. You don't hear about children. It was such a common thing for a child to die in the back seat of a locked car. Mm-hmm. You don't hear that because it became such a public campaign about it. People started becoming aware, and it changed that whole situation. We need to do that with this.
And
Yep.
there is proof in the numbers that we're presenting today that when we really are, like educating and making people aware, that we can move the needle on the fatalities. Our numbers for near fatalities for drug exposure are still high, but the numbers for fatalities are very low because we have done a lot of work in that arena and we've done a lot of training. Our hospital staffs have been trained. We're doing a lot of testing. So we're not really seeing fentanyl fatalities right now. What we're seeing is near fatalities, and we're intervening earlier, and that could have made all the difference. Like a couple of years ago when we were having these conversations, we weren't able to say that. So if we're able to focus that energy on firearms, if we're able to work with the Louisiana Department of Health and continue to educate about safe sleep practices, we can move this number. We can move the needle. I have a lot of hope for us as a state, and I really believe if we work together, we can get where we want to be.
But with the fentanyl you talked about, so that would be considered, it would go as a recorded life-threatening injury.
That's correct.
So if it's a life-threatening injury, what changes in your protocol for that family?
That's a priority one. Like, we're going out on that. We are going to see that family. We are going to figure out if that child or those children in that home are safe, and they are going to be, quickly assessed. According to our policy, we have to treat that as one of the most serious types of allegations that we can get. And there are changes, compared to what we saw a few years ago. And a lot of that is because of legislation that you all helped pass. But we are seeing the benefits of that now.
Thank you.
Okay, Brianna. Okay. So on to, Dr. Hook was just kind of talking about this, but what we are learning from our fatalities and life-threatening injuries. So again, we started doing critical incident reviews within the department late last year. We have weekly rounds, and then we have a monthly rounding. And in these, we have all of our regional administrators, and then we also have the area directors that represent each area. We have our Child Safety Response Center that's involved, training, Dr. Hook for medical, and we look at each case from every perspective to learn what we can about it. And so for our 2026, do you want to talk about lessons learned, or you want me to take it? Lessons learned for 2026?
Yeah, so some of the lessons learned, we've already talked a little bit about this, but one of the things that we did specifically is we looked at these leading causes of allegations, and what we have done is provided training to our leadership, so our area directors, our RAs focus on those concerns. So we've done safe sleep, we've done one on firearm safety. Those presentations have been shared with our leadership so that they can then distribute them to the staff, and then what we're working towards now is recording all of these so that they can then be live, like live streamed or available on, I guess it wouldn't really be live streamed, but available on our Moodle or training platform. And we will continue to do this as we identify anything that is emerging as a concern. We're going to continue to provide that education. We're also looking at a lot of the best practices from other states that has been shared with us from MPCS on something called the Base Camp, and we're looking at how we can implement that into our day-to-day work. One of them specifically is a form that I think it was believed the state of Oregon has a form on safe sleep assessment. And so we're currently looking at how can we implement that and have that be part of our workers' evaluation when they're going into a home for an infant.
This is just a representation of some federal data that is available. There's an annual child maltreatment report that comes out from Health and Human Services. That information is reported on a federal fiscal year, so it's a little bit different than we were just talking about on a calendar year. But we wanted to show you kind of what we're seeing for fatalities of children when we look over time. And what we see is that we have a lot of lessons to learn from critical incident reviews if we want to actually move the number down. It's been kind of steady over the last 10 years, but our goal is to have this as close to zero as possible. Do you want this?
Yeah, I can do this one. And so then this is one of the slides.
Can you explain that to me? So the the federal number is based on the criteria that they judge as to be a legitimate abuse, neglect, fatality. Is that the difference?
No,
Oh.
it's the, sorry.
Sorry, I'm so sorry. So it's just the federal fiscal year, so that's why the numbers are a little bit different.
Okay,
Yeah,
okay.
it's just a different time
So that's
period.
just okay.
it's just for
okay.
the federal fiscal year.
So the substantiate, how many do we have that are not substantiated?
So of the currently, now that doesn't mean that number wouldn't change, and I'm going to, please don't
Yeah,
make
you
me
said-
do math on
you
the spot,
said
but 55 minus
55,
20.
but those are all
Yes,
substantiated.
so 30.
How,
Yeah.
30?
No, 25 at this point have been substantiated. The 55 number that we were talking about later, those are total calls that we have received. And that's why it can get a little bit confusing because we report out the numbers of calls that we receive for concerns of abuse or neglect, if there's suspicious circumstances. On the slide that we were getting ready to look at, slide 23, those are cases that have been substantiated by the agency. Of the 25 that we're looking at for 2026, 19 of those have been substantiated and fully closed. So that means there will be, like everything that needs to be done for that case has been done. All the information that we need to collect has been collected. And so all of those numbers should be to the Ombudsman's office. There are an additional 6 cases that we have where we have made a substantiated finding, but we're waiting on additional information to make sure that we can fully close that case. And if we have the information that is needed, those are also reported to the Ombudsman's office. And so I do know that they have at least one of those cases as well.
Senator McMath?
How does the MDT review play into y'all's whether you're closing a case or not?
And so the MDT reviews, we do participate in one, especially for the Alexandria region. But
You don't participate in all MDT reviews?
no. So in the Orleans region, Dr. Mehta participates in those, and in some of the northern regions like Shreveport, Dr. Rodriguez participates. Both of them are child abuse physicians that are board certified, and so they do have some clinicians that they work with. If we're requested to participate in any of them, then we do. I do participate in the child death review panel for the state, and then also the fatality review.
Your office doesn't participate in MDT reviews in Covington?
Which type of MDT are you? Because I think
Maybe I could be confusing this as well.
I think we're talking about
ones
two
that we do in
different
the
things.
region.
When we're talking about closing out cases,
So that is a different MDT review.
I'm talking about sexual abuse and
Correct. So actually, what happens is, in the regions, they have MDT reviews that we call ourselves, that we have, where we bring in doctors, law enforcement.
Just within
to
the
discuss
department?
Right, to discuss complex physical abuse, medically fragile.
not
that-
inclusive
like
of
that.
CAC, local CACs or law enforcement?
Law enforcement is involved, but we have our MDTs with our CACs, and yes, we participate in those too. So that's two separate
Okay.
things.
Forgive me for,
But I don't specifically participate in all
Okay,
of those,
understood.
is what I'm trying to say.
okay. Okay. Thanks for
The question
clarifying.
about closing cases.
Yeah.
So we are in the process of working out, because that's, goes into effect in January, regarding law enforcement and DCFS. We cannot close out the case until it has been staffed at the
That effective
MDT.
date's January 1?
Yes.
Okay.
So we're all working on getting that out to the field and getting it put in our policy.
You
so
don't
that
foresee
it's
that being a
clear.
problem by January 1, right? Okay.
Absolutely not.
Okay. Okay, thanks.
We're on slide 23, and so we were talking about for state fiscal year 25, there were 29 fatalities, and so that was what was updated on your slide. We had 27. 2 of those cases were updated through our backlog closure. And I know that one of the questions that does come up a lot is prior DCFS involvement. And so 16 of the 29 in 2025 had prior DCFS involvement of the substantiated cases. And so far, 10 of 25 have had prior DCFS involvement of our substantiated cases.
And to add a little more information to this, I know we talked last session, I think Senator McMath, it was you that had brought this forward about Arizona's website. And so we spent a lot of time looking at that and we've met with Arizona. It's not real-time information. It's real-time based on when they finalize reports and put them to their website. There is some constraint to be able to post that level of information to a website based on Louisiana's law, but we did make the decision internally.
What are the constraints specifically within the law? Where can I find that?
And it's still related to Resolution 4656.
What is Resolution 4656?
Statute.
Sorry, I'm sorry.
Okay.
See, again, that's why I should not do any legal discussion or keep me in my lane.
Go ahead. Yeah, I'm just, so
Yes, so we
you-
cannot post publicly to the extent that they can. So Arizona had changed their law substantially to allow broader disclosure of information. So we, as part of redesigning the website for DCFS, there is a page that is in development that is going to contain all information that's allowable under law today. So that should be going live by the
if a
end of the
law,
calendar year.
if a bill was proposed to mirror what Arizona is capable of doing, again, in the vein of more information, more transparency, better, would this department support that legislation?
Yes.
Okay. Thank you.
And since we'd have something built, it'd be much easier to get it up.
Okay. I didn't mean to cut you off.
This is one of the toughest slides, I think, for us to talk about, deaths of children in DCFS custody, but I do think it's very important for us to spend some time, talking about this topic. If you will look at the numbers from 2025, we did have 7 children that died in DCFS custody. The number of pre-existing medical conditions, that was a great contributor. So many of these children were very complex. They had complex medical needs. Some of these children were not able even to leave the hospital, like it'd really be in a family setting. But we did have 2 cases that were reported to us as abuse or neglect. Those allegations were actually from the biological family, and so one of them was prior to them coming into care, and then the child very shortly passed away after coming into care. The other case was one where he did live and reside for some time in foster care, but when the coroner did, and this would be one that potentially, would not have been reported as abuse or neglect had there not been an autopsy, because he had some chronic medical conditions that contributed to his death. But when the coroner reviewed all of the findings, he felt that had he not sustained the physical abuse that he had sustained, he would not have succumbed to those injuries, and it predisposed him to that death. And so that was the final finding from the autopsy. So those are both recorded in our total number of fatalities from 2025. You may notice today that we presented information about 54 fatalities from 2025. I believe the Ombudsman's office had 53. That's because we received an allegation of abuse or neglect this year for a fatality that actually occurred in 2025. So we did update that number to reflect the allegation that we received.
So give me the number of deaths for last year and this year total.
Fatalities
for last year.
total of fatalities or fatalities in foster care or deaths in foster care.
Within DCFS, DCF custody can mean foster care or that you've been out on the case.
So 54 for 2025.
Now, is that foster care only?
No, that's total reports received.
Total, that
total
means-
reports, and that doesn't mean total substantiated reports. So substantiated reports for that year would be 29.
Okay, so let me say this. 54 includes foster care and those where you've been to the home before. What does it include?
No, in our custody we had 7 deaths.
Seven
deaths.
What do you consider in custody?
If they were in foster care. Foster care.
Okay, then in foster care was 7 for 2025, right?
Yes, that's correct.
Okay, now what about the number of deaths or fatalities where you had investigated the home and the child later remained in the home and passed away?
I can give you the total number for substantiated cases. which was 16 in 2025.
Tell me what you mean by substantiated.
So that means when the department investigated that report, that fatality, we found that the family or the caregiver was in some part responsible for that child's death,
Okay.
either by abuse or neglect.
What other number you have for 2025?
So we had 16 of 29 for 2025 of substantiated cases.
And so the rest of the 29 were unsubstantiated.
Correct.
So
Or no,
I-
no, that was prior DCFS involvement. That was prior DCFS involvement
That
you'd
was
asked.
prior to DCF involvement.
So that was with prior involvement of either the victim or the caretaker, the perpetrator, the alleged perpetrator.
So 16 substantiated means they were not in your custody, but you had had contact with the family.
No,
No,
I think we're talking
because-
about different things.
I think so. And then also, if you recall, the 2 cases of children in our custody, like that would have been a substantiated finding for that biological family. So that would have been included in that number of substantiated contact.
Let me ask some specific questions then.
Yeah.
How many fatalities have occurred if you add in your custody plus prior complaints to DCFS?
Plus prior complaints, we'd have to get that number for you.
Because that's what we've been looking for every committee. You know, and listen, we discussed this somewhat last time, is this. If a child remained in the home, let's say it's 10, and out of those prior complaints you've investigated, you've asked for.
I can give you that number,
Hold on.
Senator.
You've asked for the removal of the child from the home and the judge denied it. You can say 10. And out of those 10, DCFS requested removal of the child from the home and it was denied. How many of those out of the 10? It's 5. Members want real numbers.
I can give you that number actually today.
Let's go.
Based on, and I will say it's as of August 8th, because that's
Okay.
when we pulled the numbers. But for total victims, what the agency had cases with any prior involvement, and this is total cases, not substantiated cases.
this is for 2020.
It's for 2025. It was 31. It was 58.5%.
31 was prior involvement, but not in custody.
And
It could include in custody, like, because those 2 are part of that number. It could
Okay, so those are part of the number, so it was 31.
May I clarify that
Yeah.
1 second? So when we define prior DCFS involvement, that could be related to either the perpetrator or the child. So there are cases when the perpetrator was previously a victim, and so that is included in the 31. So
Okay.
we can
So let
continue
me-
to refine that
Let me
for
make a
you.
formal request so we all know what everybody's asking.
Yes.
Okay. Number of fatalities in DCFS custody. That's one number.
Yes,
We provided
yes.
that.
And that was what?
7.
7. Out of those 7, how many was not where the child had a prior injury, but where the perpetrator, right, was, so because you're saying that the 7 in custody deaths could mean the child was in a previous home and had an injury?
So of the 7 in custody deaths, only 2 of those were reported as suspected abuse or neglect. The other deaths were related to medical, like complex medical issues that they had. And I can give you the exact cause of each death.
Okay, hold on. In custody, out of the 7 in custody in 2025, what was from abuse? How many?
2.
2.
And the 2, it's related to abuse or neglect that the child had suffered at the hands of their caregiver and is the reason that they were in DCFS custody. So they did not suffer the abuse or neglect while in our custody. It was the reason they were in our custody.
So children are hurt. These 2, they enter your custody.
Yes.
And at some point after being in your custody, they passed away.
Yes.
Okay, so DCF had rescued a child, but the truth is, by the time it happened, the child injuries were already there, and the child life couldn't be saved. Now let's go back to the other 5. You count those as in custody.
Yes.
Are they substantiated or not substantiated?
they would be unsubstantiated. They were never investigated because they were medical complications that led to the child's death. So some of the children that come into our care are premature. Some of them have respiratory issues and maybe have like a tracheostomy. And so a lot of them are very medically fragile when they come into our care. Sometimes we even know that when a child comes into our care that they're not expected to have a long life expectancy, and so we have foster parents that are willing to take them into the home knowing that it's going to
I get it. So these 7 have nothing to do with neglect or abuse in DCF that happened in DCF custody, these
Correct.
7.
That is correct. in
Okay, so those are
2025.
7. Then there's a number of prior reported. It was prior reported and the child later died. What's that number?
So that's going to be related to your overall count of reports that we received in 2025. So if we go backwards, we had a total of 54 children in 2025, and 31 of them, there was a previous case.
Okay.
And again, that could be related to the perpetrator, the alleged perpetrator, or the child.
So if it's related to the child, a previous case, then they're in DCF custody, no?
No, these are not in DCFS custody.
So the
These are
child
just-
may have a prior report but been placed with someone else.
Or maybe not. Like they could have had a prior report for lack of adequate supervision where we investigated. We believed that, family services was appropriate for that case. They may not have had another case again for several years and then come back in contact with the agency. Drug-affected newborns, the majority of those cases actually remain in homes with in-home supports and services. Our average annually is between 10 to 15% of removals on those cases, but it makes up a huge amount of cases that we receive. And so that's just something to keep in mind. That would be a prior involvement with the agency, but would not
So who makes a
necessarily know
decision when a child is born? You said drug or alcohol involvement. Who makes a decision on whether to remove that child from the home?
We would get a report, and that decision would be a gathering of information, a staffing with the supervisor, and assessing if that child can remain home in a safe environment. And if he cannot or she cannot, then we would approach the judge for an instander.
I'm just wondering what scenario where a child is born with drugs in his or her system says that this child should remain in the home?
Well, because we're talking about prenatal neglect, there could be, we could get notifications for a parent that may have used a substance prior to knowing they were pregnant. We could get calls for parents that have used substance during their pregnancy but now are in active treatment. And so there are instances where when the assessment is completed, there are protective factors that are in place for that parent, or they have a support system.
Or they
so
have
it
a
could be that they
support
have
system.
like a husband or a father in the home that is not using substances or other
Or a
types of
grandparent
supports.
that is willing
And
to
then they
take.
later die?
I can't speak specifically to that
We're
being the
talking about the
cause, but I'm saying
34
that-
fatalities.
Yeah, I can't speak specifically to each case to tell you exactly what that involvement
Okay,
was.
so
but we
these
can go-
cases are closed if they're 2025, right?
Yes.
Without divulging the name, the parish, or anything, because that's been the confusion. You have 54 deaths, and every time you hear that, you would think from news reports and everything that those 54 deaths are cases that we've actually touched. Children that we've actually touched, DCFS has actually been involved in, who have passed away, okay? So let's take this 2025 tester. From what I'm hearing, there are a certain amount of them, there's only 7 in custody, right? So what can you legally give us on a breakdown of each of those cases that does not produce the name, the parish, just the age of the child, and our prior involvement?
On the
54, 2025.
cases?
Yes. Because I think that's why this question keeps coming up, because there's no, we hear you testify and we're asking questions, but we never get to, hey, what's going on? How many of these, and this is the bottom line, are attributed to somebody in our department who did not do what they were supposed to do? And the only way that we can figure that is to get case A. You didn't have to put the date of death, just 2026 fatality. DCFS was called on this day, DCFS was called on this day, or DCFS had no involvement, whatever it is. And on this day, or however you put it, this happened.
And we can look at how we could prepare that information for you.
Without
and for
violating
the
any
committee.
privacy laws?
Yes, and what I would actually recommend is that we take that ask back to the critical incident review team that's going to be led by the Attorney General's office, because that is going to seek to pull out just that type of information, looking at every partner who had involvement with that child. So whether it was DCFS, the Department of Health, the CAC, the coroner's office, everyone will be at the table. Right now, we do it, but only with DCFS, and we do understand from the critical incident reviews we've done, there have been instances where there was something from another partner that may have changed the outcome in that case. But we will be looking at very specifically all child welfare or all fatalities reported to DCFS and looking at all of that information. So that could be a report that comes out of that body so that it's
Okay.
representative of the whole and not just us.
That's great. That would work really. Well, no, I want just you. I just want the 54 cases we're talking about.
Okay.
For 25.
Yeah, that's all I
Okay.
want. The 54, I want a very clear report on the 54 cases involving DCFS. That's what I'm requesting. I want the same thing, because I'm going to go over these 2026 numbers for 2026. And so let's go over the 2026 numbers. So for the 2026 numbers, what date does this go through?
For the foster care or the total number?
Let's go to total number.
Okay, so the total number is through August 8th, and remember that was reported as 52. And of prior involvement, we had 30, which would be 62.5%.
Prior involvement, okay.
And of that number that we had, the 52, so far we have 25 substantiated cases.
Of your prior involvement cases.
No, of the total number.
Okay.
But prior involvement of those cases are 10 of the 25.
I want the same numbers. You guys have to understand.
Got it.
When we say we're doing better, and we're at, and I'm not going to attribute that 52 to you, right, all, but we're at 10 substantiated cases by August that we had prior involvement in. All right, 10. So I want to be real clear, because I always want to be fair when we're discussing these numbers. Your number is not 52, right? I've said this. I said there is something is happening where parents are hurting their children at an alarming rate in Louisiana, right? When we're at 52 kids by August the 8th, out of those 52, 25 are substantiated. When I hear substantiated without an explanation, I'm thinking, okay, DCFS was involved. You substantiated that the abuse happened by a relative, right? Is that it? But you may not have been involved. Right. Then you have 10, which is a way different number from when the news reports 52. Because if you listen to the news, then you're going to say 52 kids have died where DCFS could have prevented it. Right? So then you get down to these 10, and I still say that is an alarming number. Like last year, how many, I'm sorry. Senator Mizell, I'm going to come back. This is my child's school.
Thank you, Madam Chairman. Just to the chairwoman's point. All these numbers are confusing, but the overriding thing is, and all the little differences, and you're kind of drawing these fine lines between differentiating and the percentages. At the end of the day, these are all children that we've lost in Louisiana, and I think the difference is the ones that were under DCFS, either custody or a call had come in, the call was responded to, or the call wasn't responded to. What has changed? What have we learned? in the methods used by the agency in the way we handle something that can have an outcome like these had? I mean, give me a specific, something that's being done differently because there was something learned by the loss of that child's life.
I think that one specific is one that I got really upset about is unsafe sleep. Because one of the things that we're doing, speaking candidly, Senator Mizell, I think is going in and saying, oh, we have a bassinet. And then 2 months later, we have the bassinet, but the baby wasn't sleeping in the bassinet because there was blankets. And so Dr. Hook did a staffing, Leslie did a directive meeting of really getting with our frontline staff, making sure the staffings are helping, and they are quality staffings. And you're asking, did you look in the bassinet? When you're in the mode of investigating and looking at things, we can just really say that there's a bassinet or there's a playpen where the baby sleeps, but we need to see the baby sleep there, and we need to make pop-up visits. And so that is one thing that we are doing, is making sure that accountability goes a long way, and that is our job, to make sure our children are safe. And so making sure that that child is actually sleeping in the bassinet and there's just not a bassinet.
So you're saying better guidance for the parents?
Better guidance to parents, better guidance for our workers, better guidance for our supervisors and the staffings to ask the right questions and managers.
Because you're not going to get a call with somebody telling you the baby's not sleeping.
No, ma'am, you're
Right.
not. You're gonna see it when you go.
Outcome of that.
You're going to get a
Right.
call.
But those that you
with
got a
fatality.
call about, or that there was some point of contact, because honestly, the hotline's always been a thorn in my side, because I feel like there's such a huge number of calls that aren't being followed through on, because they just don't meet whatever criteria. And it always worries me what's happening that forced somebody to feel so much concern. They made a call, and then we've said no, and what's going to happen to that child in that situation. So have you seen ways you need to adjust the way you screen the calls, or what have you found something that we're going to do this differently now because this didn't work out in this situation?
A part of the right response is that when there is in-your-face abuse or neglect, that's an investigation, and that
no matter who calls you.
No matter who calls you.
Okay.
Whereas when there is something going on, and I need an assessment where we can go in and really assess that home, or does that parent need information? And so I know that we say right response, but it's really addressing the call for that call and what that family needs, and recognizing that the caller is just not calling in just to call in.
No.
How that looks, it's being built out, but I really truly believe that where we start is where an investigation and in that in-your-face neglect and abuse, kind of like it's on fire. And those families who just need that really good assessment of just going in and looking at the whole environment and really trying to figure out what is going on. It may have brought to the caller's attention one thing, but there may be a symptom that we need to find.
Exactly. It's a moment of contact with what could be a really bad situation that you can totally change the trajectory of that child's life. So I think that's incredibly important. We could have a cup of coffee and talk about all that. Yeah. But I just wanted to have some comfort that, okay, we've learned from
We've learned it.
Yeah, okay.
Yes, ma'am.
Thank you, Madam Chair.
Apologize, I'm back. You see your child's school, you answer, especially when it's after hours. So my question was, let me figure out, okay. So we have 10 as of August the 8th that we had prior involvement, and we had a fatality. Last year, how many did we have with prior involvement with a fatality?
Total or substantiated?
Substantiated.
Substantiated.
Because we had 25, and then it was substantiated, and then you had 10.
Yeah.
You had 10 that was substantiated
Yes.
with prior involvement.
And we had 16 in 2025 of 29.
Okay. And I'm going to reserve the rest of my questions until we get those reports. I kind of needed the breakdown of this because, like I said, you hear, and look, 10 is not good, 15 is not good, it's never good. But you hear, and I'm sure we're going to hear from the ombudsman on this, you hear 52, 54, 55, and you're trying to figure out how many of those children did we have an opportunity to rescue that we didn't.
Right.
And then there's another hurdle that I talk about now is that why are Louisianians prone to hurting and damaging our children? That's a whole nother issue that I'm not sure that policy will fix. But I say that, I mean policy through DCFS. There's a safety net. There's some safety net policies that I believe can fix it. That we steer away from, as a whole in the state, right? That will fix some of it. And that's properly funding education so children have a safe place. That's not, number one, right? And they're well educated and able to speak out. There are some things that systematically we've broken down in the budget that could really help our families. And that's what I mean by policy here at the end of the road of DCFS investigating can't fix that, right? But what can fix it is us creating policies that offer people a better life in Louisiana, period. Because when parents are able to take care of their children, some of this just doesn't happen. Ombudsman, I think you are, let me make sure. DCFS, you have two more, and I'm going to call the ombudsman up. Is that okay? Okay, great. I think you have a couple of more slides.
Did you have any additional questions about slide 24, which was the foster care slide?
We're on the.
Just
How
wanna
did we
make
get to
sure.
foster care? We hadn't even gotten to E yet. These are the DCFS in custody. Okay, yeah.
Yeah, I just
No,
wanted to
no.
Yep, and so just what both of you, Senator Mizell and Senator Jackson Andrews, have been talking about, what are we learning to ensure that we are changing policy, changing practice so that we can intervene. That is where safety science comes into place. We have been handling critical incident reviews within DCFS since December 2025, and it is to do just that, to produce change within the system. Every review, again, looks at each case from a clinical perspective, policy perspective, practice. We always look at the individual doing the work, and then training. And we ask what should be or could be different because of what we learned to change outcomes for the next children. Dr. Hook talked about some of the work that we've done around safe sleep. She has done trainings around new drugs that have come into Louisiana in the northern area. And also when we have found that there was inconsistent practice as it related to how we handled drownings due to lack of adequate supervision, rather, and this is swimming pools, ponds, other large bodies of water. We did trainings for staff in those areas. So we're using it to detect any patterns in what we're seeing and then to make changes statewide. The Attorney General's Critical Incident Review Team, this is from Act 960. I know the Attorney General's office has already sent out the request for designees on this panel, and they are looking to convene before the end of the year. And this will bring together all of the partners in the continuum to make sure that we're making system-wide improvements. Because to y'all's point, there are some things that are simply outside the span of control of DCFS. And we do have someone here today, Senator Jackson Andrews from the National Partnership on Child Safety. I don't know if you want to call them up before we move to a different topic.
Yes, please. Welcome to committee. State your name, your position for the record.
Sure. I'm Mike Collin with the Center for the Helping Professions. The Center for the Helping Professions is a national nonprofit, and we're the home for the National Partnership for Child Safety, which has been mentioned a couple of times today in testimony. The National Partnership for Child Safety is a national quality improvement collaborative. It's modeled after similar quality improvement collaboratives in other safety critical settings, places like aviation and healthcare. It was born of the recommendations from the commission report, Dr. Mazzell, that you've been referencing, specifically the application of safety science in child protection. There are 3 national partners involved in support of the national partnership. Casey Family Programs provides the financial support and some infrastructure. The National Center for Fatality and Prevention, which was mentioned by the CDR presentation earlier from the Department of Health, they provide the data warehousing for data to get shared into the national partnership. And then our center provides all the training and technical assistance. We specifically work with child welfare systems, helping them develop a systems approach to looking at child fatalities and near fatalities. That's bringing in a look at these critical events that would be similar to looking at medication errors or wrong side surgeries in a hospital or an accident in aviation. So it's bringing in that root cause analysis approach to looking at it that differs from the kind of review that you would see from a CDR review. So generally speaking, and these are broad categories, there's kind of 3 types of fatality reviews that go on. There's the CDR reviews that you had the presentation on earlier, and that comes from a public health lens. It's kind of about the epidemiology of all unexpected deaths. There's oftentimes some sort of public accountability review, if not multiple, that comes from someone like a child advocate or an ombudsman or someone looking from the outside from a public accountability lens. And then typically jurisdictions will do some sort of internal review that's really about quality improvement. And I think I just very specifically address some of your questions from earlier today by kind of threading together those kinds of reviews and plugging in where the partnership fits, specific to some of the conversation that's been going on around unsafe sleep fatalities, which is our most frequently occurring fatality in our data set across the country. We're currently working with, I think the number now is at 51 child welfare jurisdictions. This is a combination of state jurisdictions like Louisiana, county level like LA County or New York City, and then we have just added 11 tribal child welfare systems. Whereas the CDR would approach looking at safe sleep from a public health perspective, and their recommendations and the really good work that came out of that public health lens would be all the ABC work that we've been doing now for probably decades. This idea that alone on the back, crib, don't smoke. Keep blankets out of the way, keep stuffed animals out of the way. So that's kind of a public health approach to addressing this problem that we were seeing with unsafe sleep or sleep-related fatalities. An example of how a review inside the child welfare system would then advance that would be a system that we worked with that was digging into being better at providing prevention services for safe sleep inside their jurisdiction, like what's in their scope. And identifying that their child welfare professionals could not get access to, in any kind of timely way, any sort of safe sleep furniture, so like a bassinet or a pack and play or a crib. There were all these kind of myths and financing issues and requests that would go to fiscal. That's the getting in the weeds, I think, behind the specific cases that you were talking about. So it's not the high-level public health response. It's digging in at the level of the cases and identifying what those root causes are that are getting in the way of professionals being able to do their job. And then if you roll that kind of thinking up to the national partnership, what we've done is launch Safely to Your First Birthday. These are kids under 12 months, these safe sleep-related deaths. And what the alone back crib approach didn't do was be specific for child welfare professionals. And so we've developed a national curriculum with input from the American Academy of Pediatrics that we've now rolled out called Safety to Your First Birthday that focuses on what you were discussing, which is like how do we train those child welfare professionals that are going in the home to be more tuned into what's going on and to be better at engaging with the families around sleep-related issues, because we've known for years that we had significant reductions in these fatalities and then we sort of plateaued off, and much of it is probably cultural and people wanting to co-sleep and not understanding that it's not good to put teddy bears in the crib. And so developing specific strategies for child welfare professionals to engage families is a part of what the
Senator
national
Mizell for a
partnership is.
question. I apologize.
Sure.
I'm sorry to interrupt
No, no.
you. So you're specifically working with DCFS on sleep?
Oh, no, on child
Oh,
mortality.
on the whole thing?
Broadly, yeah.
Okay, just
Yeah,
want to make
we-
sure I understand it,
yeah.
because most.
Because
and-
as you guys have seen and talked about and know well, they're all very different. Sleep
Okay.
deaths.
Oh, no,
yeah.
absolutely. But a few minutes ago, you mentioned working in collaboration with the ombudsman and different agencies. Have you? Have you
we-
worked with have you met with those people yet?
I haven't here. So I should have a caveat. You guys just joined, Louisiana just joined the National Partnership for Child Safety. So I don't know.
Oh, so we weren't members of the partnership before?
No, you've just joined, I think, in
It was
May.
this summer.
Yeah, May or June. So
Well, maybe
you've-
our problems are solved.
So they'll attend a convening. You've got a team coming out to a convening in 2 weeks in Denver, first week of September,
So
which
you're
will bring
here kind of
together
on the scouting.
40 child welfare
You're
systems.
kind of scouting as to what to focus on for the benefit of Louisiana?
We'll do a lot of work breaking down your process, the way that you do reviews currently. They vary across jurisdictions, and you've actually brought this up a number of times. Definitionals vary greatly across jurisdictions, and it's
right.
super challenging.
We got to fix that.
Laws vary, resources vary. So whereas LA County has a whole team of people that do these reviews, Arkansas is one person. So we have to bring our approach in and kind of wrap it around your resources and your laws. We'll help you build, if you need it, and I don't know yet for Louisiana, a database that actually allows you to look at your data and compare your data to the national data set that we're collecting through the National Center.
Like on a public level?
It won't be public facing, and it'll be up to you guys to decide how you use it and discuss it. It won't be
But you
public
make
facing in that people will be able to
You'll
log in.
make recommendations.
Yeah, it won't be public safety facing in that people will be able to log in from the public and see the information. It won't be.
Okay, okay. Thank you. Thank you, Madam Chairman.
Thank you. Yes, the board is clear. What we're going to do is, we have some constituents that are going to have to leave, okay? So what I ask is our state departments and entities who work with us, and it would be good to hear from them because questions are going to stem from them, and you would have to wait till they testified and wait till they testified and come back. We're going to hear from constituents who filled out cards, even if it's regarding foster care, okay? Because I'm getting too many messages that people have been here all day and have to leave. We have Chris, that's with the Department of Children and Family Services, Department of Children and Family Services. Hold on one second. We have Danielle Ely. Am I saying that right? Okay, foster parent. We have Lindsay and Ombudsman Office. We're coming back. We're just trying to get the parents out that need to get home to their children. I know, but I'm going to want to ask you some questions. I'm sorry. That's what I was saying. I apologize. We have Lindsay Mothershead. Is that right? Mothershead. You can come on up if I'm calling your name. Shane Purvis. And we have Mrs. Bowman. And once one of them cleared the table, we have Mrs. Gonzalez. And I'm sorry? And you're going to come back up. So if you guys can just take the front seat if you plan on testifying. If you're a constituent here for one of the issues on the agenda and plan on testifying, please come up. And you can sit on the front, on the first row, if possible. Welcome to committee. State your name, address, and your testimony.
Hey, my name's Danielle Ely. My address is 6230 Highway 15, Gilbert, Louisiana. Are you ready? Should I just go? It's kind of awkward talking about this because Secretary Harris and her team hasn't had a time to talk about it yet, but it is on the agenda.
Right.
It's
We
regarding.
just understand that some of you have to get home to your
yes.
children.
Yes, we're
And
from
so
far away.
Madam Secretary would have testified, and you would have testified, and she would have had to come back up.
Okay.
So what we're doing for you to get home to your children is having you to testify.
Thank you very
And
much for that
then,
consideration.
You can listen on the way home.
Okay.
If you'd like, just in case you have to get home, because we're hearing from some, they need to get home.
Yes,
And members are going to be writing down and talking, and so when we get, once she presents on foster care, then we'll be able to ask those questions. And maybe she will, address some of them once she hears them, okay?
Okay.
those concerns. Yes,
Okay.
ma'am.
Thank you so much for giving me this opportunity to speak. I've been a foster parent now for 4 years, and that entire time I've had the same 2 little children in my home. Their case is almost 6 years old, but that's not what we're discussing today, not the untimeliness of the foster care system. What we're talking about is the board rate change that just recently happened. I'm not even going to bring up too much of the mileage because I know other people are going to bring up the mileage. What I'm here to really talk about is how the rate change isn't very forthcoming and how it's being packaged as a raise for most foster parents when the reality of it is it's actually been a consolidation or just a reallocation. Nothing is really going to go up, even though it's been over 2 decades since there has been a look into what foster parents get compensated for. So in my particular case, currently right now, I have 3 foster kids in my home. 2 of them are receiving special board payments, which helps compensate for the special needs of those children. They're nonverbal. They have substantial IEPs. One's in a self-contained special ed classroom, and because of her exceptionalities, she's not even allowed to stay in school all day because at the age of 5, she has a behavior intervention plan. She goes to therapy 5 days a week. My husband's currently picking her up from therapy right now. Mondays are our biggest therapy days because we don't have school in our school district on Mondays. So on Mondays, they both have 2 speech, 2 OTs, ABA for 4 hours, and then the other foster child, that's usually when we do follow-up dentist appointments for his substantial tooth decay. Today he was picking up glasses because he's pretty much blind in one eye. And all that stuff we signed up for. And I know we did. We stepped into the realm of children in crisis. We did it out of the goodness of our hearts. I was raised by my biological mom, who was also a foster parent and a caseworker. So I was raised with it. I saw the need, and my family does it wholeheartedly and willingly, and we're glad to do it. Payment, I don't even think my husband even knew we were going to be getting board payments when he agreed to do this. And so the $19 a day per child, that's what we live with, and it was okay. And then, of course, I told you my kids were getting special boards. A standard, it was like a $300 thing for the 2 that were special. And so what they did with this new package deal is they took away all forms of reimbursements. And so those reimbursements were very, very helpful, very, very relied upon in the care of these foster children. Not only am I a foster parent, but I run a nonprofit organization in Franklin Parish, which is a very rural community where we have a group of 25. Now it's gone up to 35. We work with foster parents, kinship parents, and then also biofamilies. Family Services calls us when they need help getting supplies for their biological families, either to keep children from being removed or to step in right before moms get their kids back to help with bedding and school supplies. And so my organization doesn't want to tell people no, but in the past month, with the influx of kinship placements coming and not, okay, I'm going to stay on track. So I'm talking about my family, and then we'll talk about that later. So what's going to happen with the reimbursements going away and kind of being consolidated or repackaged into this, they call it a greater board rate payment. We're no longer be able to get when those big things come, whether it's school supplies, school uniforms, if the kids outgrow clothing, if they've outgrown their car seats, if we are summer camps. My kids are really looking forward to summer camps. They do dance, they do theater, they do soccer. We just signed up for soccer. All those things were reimbursable prior. And so now what they've done is they've taken away that opportunity to get reimbursed after those things and are giving them to us up front and giving us all the same thing across the board. And when you do the math, it's roughly 600 plus roughly 300 equals 900, and that's what they just changed it to, roughly, figuratively speaking. And so there was no increase. It's my point that I was trying to get out to you. And it's being very misleading to package it and show it to the state as it being a board rate increase, because it wasn't. And then for the families like mine who have substantial medical needs or substantial behavioral needs or substantial therapy needs, it's actually going to be a cut. Because if they're going to do away with the special rate payment, the special board payment, like we've been told was going to go away, that's going to take away, plus the reimbursements. I did it for my family. It was $6,500 per year less.
Less. So this new model that we moved to, that we actually voted for it, because, you know, and a lot of foster parents advocated for it because it said it was going to add to it. The plain face of the legislation, for all purposes, said add to.
Right.
I'm trying, and I've received these calls from my constituency, and I'm sure the department is going to explain this because we voted for legislation, you supported legislation that was going to add to what you receive for children. And now we're hearing in your family, you have how many children?
I have 3 foster kids.
And is that a total, that $6,000 a year, a total for all 3 or a piece?
I did it based on the 2 I've had the longest. The
Okay.
3rd one has been recently placed. So that's based off of the 2 children I've had the longest. The average reimbursements I get, including mileage, back to school shopping, summer camps. And since I won't be getting those reimbursements, and if they take away special boards like they say they're going to take away the special boards,
What special boards?
it's a compensation for the difficulty of care that your child is leveled at.
Okay.
And it's kind of handled different by caseworker.
And I know we're going to, in the presentation, it says it was a 95% increase. So we're going to,
They're reviewing those individuals.
but they're reviewing individually. So we're going to get to that. I've heard from foster care parents all over the state.
It's just been very misleading, but I mean, you can do that simple math that if it used to be about 600 and I used to get special boards of 300 and now they're giving us 900, that's just flat. That's just an exchange. But then you also take away mileage reimbursements and all those other reimbursements. Like I said, I represent a lot of foster parents. They're scared. They're worried, they feel discredited, discounted, overlooked, unimportant, and used. And these are the most vulnerable children in our state, the children that I care for, no one else is going to take. And that's why they're still in foster care. I mean, it's been 6 years. It is the hardest to place children in the system, in the state, and taking away the special rates that come with them because they are so difficult to place is going to be hard.
No, I totally understand, and we appreciate, let me say this, because I could say this 50,000 times before I go to the chairman. We appreciate what you do.
Thank you.
We understand that our foster care system is overloaded, but children need a stable home. And you provide a stable home, and I want to say this to everyone listening that know what it all entails. This is not about money. We couldn't pay anyone in this room enough of what you're worth and what you do for a child when you bring them into your home. And this is not about making money. I want to say this on the record, because every bit of what you get goes toward those children and more. And I want to be very clear about how we look at this as a panel, as a group of legislators. Each of us have children, our grandchildren, and some who raise their grandchildren. And we know the expenses that are associated with it. We see, what you receive from the state, and we know that you are making a major investment of love and financial resources into these children, and that's why this was on the agenda as soon as we heard about it. Chairman McMath.
Oh, I can wait until the public testimony is over.
Okay, thank you. Welcome to committee. Yes, ma'am.
I have severe anxiety, so I'm going to just read if you
Yes,
don't
ma'am,
mind.
and I hate to ask you this, but we have to do it every time you come, even though we've seen you once today. Your name?
Okay, I'm getting there. My name is Lindsay Mothershed. I am the mother to 11 children. I have 7 children still living in my home. 5 of those are under the age of 6, and 3 of them have already been adopted from foster care. My 2-year-old twins, I'm not going to go into extreme details, but they were shaken. They have significant brain damage. They have neurological issues, quadriplegic cerebral palsy, epilepsy, trichotillomania, and the diagnosis go on and on. Feeding tubes, they require extensive daily care, specialists, frequent medical care, and numerous hours of weekly therapy. I think we're at 12 to 14 hours of therapy a week. I want to be clear, I support increasing foster care rates due to inflation. It is absolutely needed. My concern is that this increase comes at the expense of the children with the greatest needs. A medically fragile child requiring feeding tubes, extensive therapy, specialized equipment, specialists, and lifelong care does not cost the same care for an average foster child. Yet their board rates for care are now the same. The special board payments and reimbursements being removed existed because these children have extraordinary needs, not only because of their extensive level of care, but also the mileage required to transport and meet those needs. Removing those reimbursements doesn't remove the child's specialized needs. It simply transfers the cost to the foster family. Special board payments were their form of disability payment. Post-adoption, these medically fragile children either get special board payments or they get SSI disability. These kids are denied SSI disability based on the income of the adoptive parents. The state of Louisiana just took away the only form of disability that they actually qualify for. We should never create a system where a child's access to disability support is reduced because someone was willing to open their home and permanently adopt that child. We live in rural Louisiana and have extensive medical and therapy travel. DCFS is suggesting Medicaid transportation instead of mileage reimbursement. My children have severe sensory and neurological disabilities. Unfamiliar people and environments can cause significant distress and dysregulation. They are also staph carriers and prone to frequent infections requiring hospitalization. Unsanitary and unknown environments subject them to unnecessary risk. We also have medical equipment, feeding supplies, and other necessary things to transport. Prudent parenting should mean treating a foster child as we would treat our own child, and I would not routinely put my child into an unfamiliar vehicle with an unfamiliar person simply because that transportation is free. That is an added and unnecessary trauma to an already traumatized child. My biggest concern is what happens to these children if families can no longer afford to say yes. DCFS already struggles to find homes for medically fragile children. If the reimbursement doesn't reflect their level of care, these children will become even harder to place. The state doesn't eliminate the cost by eliminating the special board and reimbursements. It simply moves the cost somewhere else, potentially into a much more expensive residential environment. If I was asked today, based on the new payment policy with no special board and no mileage reimbursement, to take these twins who will need lifelong care, I would have to say no. I cannot afford to take on that financial burden without the added reimbursements and special board payments. There is one other issue I want the committee to consider. And I'm going to have to be very strategic about how I word this. When my twins came into care with their neurological and brain damage, they already had an older sister in custody for over a year. My concern, despite the existing case, they were allowed to go home with the parents, and the state of Louisiana said that the parents have not given them a reason to remove the children. They were subsequently shaken and entered foster care with significant brain damage and neurological issues and labeled failure to thrive, weighing only 8 pounds at 4 months old. My twins' disabilities were not inevitable. They were absolutely preventable. There was a point when they were healthy babies who could have been protected. They now have another baby sister who has been allowed to remain in the custody of the parents. DCFS has said the same thing. The parents have not given them a reason to step in and to protect her. So my question is, at what point does a neglect and abuse pattern with zero case plan progression and compliance become enough to protect a child? Thank you.
Thank you. Welcome to committee.
Thank you so much. I really appreciate y'all's time and the opportunity to be able to speak today. My name is Shane Purvis. I live in LaRondra, Louisiana, in Tangipahoa Parish. My wife and I have been foster parents now for roughly 10 years. We have currently in the home, we have 3 children. 2 of those we are legal guardians of. One is a 12-year-old. We've had him for 4 years. Another one is a 17-year-old. We've had him for about 10 years. He is autistic, a whole nother subject on him about to age out and not a whole lot of support for that. Recently, about 3 months ago, we received a call for an 8-year-old. So we accepted this young little boy, brought him into our home, and we had heard about a rate change that was going to be happening, and we were hopeful for something good to come from that. But when we got the paperwork explaining this, different documents, some of the wording from those documents said that this is going to be a historic increase, and it does away with the cumbersome and delayed reimbursement and special board rate. This rate adjustment also achieves a major administrative goal. It completely eliminates the paper-heavy reimbursement and special board process that historically has strained both the caregiver and the DCFS staff. So I know it's kind of been spoken about already, but the special board rate, when we calculated the new rate and we took away the special board rate that we're getting for this young child, we had an increase of about $14 a month. Now that doesn't account for the removal of all the reimbursements, as it's already been said. What are some of the reimbursements? It's time for school. So you got school uniforms, you got school supplies. We have been told through the roughly 10 years that we've been foster parents that take your children to special events. It's covered. Just turn it in. We had a child that wanted piano lessons. Turn it in. It's a reimbursement. All that's being taken away. As you had said, we feel like we're being played. That may not be the reason. I'm going to say it's not. But that's what it feels like here in the weeds. Another reimbursement that was removed, as has already been talked about, is the mileage reimbursement. In the month of June, my wife drove over 1,000 miles for this 8-year-old boy. Where was she going? To the doctor, to the therapist, to the dentist, to the weekly parent meetings, to summer school, back and forth. That's being taken away. Now, we did just receive some documentation that said caregivers can arrange transportation through an approved third-party provider like Uber and Lyft. I don't plan on doing that. These children...
Who did you receive that from? I apologize.
We received that email from DCFS.
These
So
children...
wait, you were, up until this point, you were transporting your own children like
Every day,
any
there are
parent.
Correct.
children.
And we were getting reimbursed for mileage.
But now you would have to call a third party, wait on that third party. Okay, Madam Secretary is shaking her head. We're going to call her up after this panel. Just answer that question. Go ahead. I apologize.
No, you're good. Well, that is in this email that we received. So these children they're already traumatized. They need consistency. My wife wants to be at the doctor's office to talk to the nurses. She wants to be at the parent meetings to
Just
watch,
like any other
to
parent,
listen.
you don't.
Right,
Now, medical transportation, we're being told, can be covered through Medicaid. So again, remember that this was talking about one of the things that they wanted to do was eliminate the paper-heavy reimbursement. Well, it's going to be eliminated for DCFS, but it's not going to be eliminated for us because now if we go through medical transportation.
Is that a third party as well?
No,
well,
it's separate. It would be filing it under Medicaid and not using Uber.
And I do want to mention that Medicaid reimbursement for mileage is 23 cents a mile, while DCFS is 72 cents a mile.
And that's only if you jump through the hoops Medicaid is set up.
That is correct.
All right, we understand Medicaid, trust me.
And the paperwork that us parents has to do is more than what we were having to do. Now we have to call this NEMT broker and receive prior approval. We have to fill out the form. We have to take it to the physician. Then the physician has to sign it. Then we have to either fill out online or mail it in, whereas before we could just keep a form, keep track, and when they came for the monthly visits or we went to the weekly parent meetings, we could just hand it to them. It wasn't an issue for us.
Right.
And now, I'm sure the paper-heavy, it may be on the DCFS side. So the changes that we have here on this 8-year-old child in the month of June, when you calculate just the month of June, we would have paid out, would have paid out over $1,000, which in the past we would get reimbursed for. So this is not a historic increase. It's not. It will have repercussions. I have an adult son and his wife who had started the process of being certified. I don't know if they're going to go through with it. We have people at our church that's been interested in it. I don't know what they'll do. Again, we don't do it for the money, but the money makes it possible.
Oh,
Thank
I
you.
totally understand. Yeah. Plus, your money makes it possible. Not just the money that the state gives, but your finance it make it possible. We're going to hear from the remainder of the parents first.
I'm sorry.
Hi, my name is Callie Gonzalez. I'm from the Tangipahoa District, and I'm here as a dual constituent. So I'm a former fictive kinship parent, but I'm also a licensed professional counselor. So I want to give you an alternative perspective on some of this stuff.
Yes.
Members of the committee, thank you for your time. In July of last year, I was 3 months postpartum, and I got a call from a teenage girl in my parish that was in foster care. She wasn't a relative to me. She was a member of our community that I'd crossed paths with, and she was in need of a home because her placement was disrupting. And taking her in would mean that she got to keep her school, her job, her church, her friends, all the people that really are connected to her, things that foster teens typically lose whenever they're placed in another parish. And according to her, if she couldn't find a placement, she was going to be sent to a group home. So we said yes. With a newborn in the home and me being on unpaid maternity leave, we said yes. Here's the part that I really need you guys to hear. We were told by DCFS not to bother getting certified, not because we couldn't qualify, but because certification would take so long. By the time it was done, she was going to turn 18. So she was in care for 5 more months before she aged out, and we did not receive a single board payment for the 5 months that she was with us. But what we did receive were reimbursements. That was mileage and receipts of her expenses. That was the entire financial support that we received from the state of Louisiana for a child in their care in my home. And so we stretched our finances to make it enough. Well, it bought her scrubs for her CNA classes at school. It bought her CNA supplies like her blood pressure cuff and her pulse ox. It got her hair done before school so she could be confident going into her senior year. The mileage covered me leaving work early so I could get her after her shift ended at her job, or to take her to a doctor's appointment, because she had no car and that job wasn't going to be another thing that was taken from that kid. Every dollar went back into her. Not $1 of it did anything else. As of July 31st, every reimbursement that made this possible is gone. If the same call came to my house today, we would receive nothing this time. No board rate because I couldn't get certified in time, no mileage, not one receipt. And S would have likely gone to a group home. My name is Callie Gonzalez. I'm a licensed professional counselor. I've practiced as a therapist since 2024, specializing in attachment and trauma, and I see a lot of foster and adoptive families. Before that, I spent 8 years in inpatient psychiatry and roles from direct clinical work to hospital leadership. And across those years, I worked alongside the Louisiana child welfare system in several capacities, like having a kid on my inpatient psych unit, or doing, I did the kinship navigator program at one point, helping certify families. I'm not here to oppose the board increase, just like everybody else here has said. I support it without reservation. It's long overdue. But my thing is, it seems like we've conflated two different announcements into one thing. So the issue number one was the board rate wasn't keeping pace with the cost of raising a child. And so we did need a raise. But here's the deal. It's not a raise, and I would ask the committee to stop allowing it to be called one, because a raise is compensation paid to a worker, and a board rate is a pass-through for a child's expenses. DCFS' own policy says it can't be used for anything else. And then we have the second issue. DCFS eliminated itemized reimbursements. For sure, on their FAQ page, it states that they took away special board, mileage, certain clothing and school uniforms and school supplies. Let's see. But the language in the FAQ says now it's included in the board rate. It's covered by the board rate. You can't call something a raise and a consolidation in the same breath. If mileage and clothing are included in the $308 increase, then some or all of that money isn't new. It's the old itemized support relabeled as a new number. And we already know that that number does not clear, because roughly $56 of it is already spoken for before a single mile is driven. The department's own word, included, is the thing that kind of unravels all of this. The legislature funded the first one. I specifically last week went back and I looked at that meeting recording from March 23rd, 2026, where DCFS proposed their budget for fiscal year 27. They talked about how much it was needed, and the legislature was very supportive of that raise. But she did not say a word about the idea of taking away mileage or taking away any reimbursements. To my knowledge, based on what was present in that meeting, it didn't seem like the legislature was aware that there were any intentions of removing those things when you guys said yes to a raise to these foster parents. So I want to give you three numbers. The increase is about $308 a month. Like I said, 56 of it's already spoken for by replacement clothing and school supplies and uniforms before anybody puts a key in an ignition. So the amount left, what that buys, is 11 miles a day. That's the entire policy expressed as a number. A child who generates more than 11 miles a day now costs their caregiver more than the state is providing. And not only that, that's for just an average kid, not the kids who need these additional special board rates. So the state didn't overpay anyone. At its most generous, for the least complicated kid in the system, it roughly broke even. The department set the rate using the caregiver survey with 42% response rate. That's the department's own number. I don't have the time to get into why the sampling of that response rate is not statistically valid, but I'll keep going. DCFS published a frequently asked questions document about this change. One of the questions that they have is, where can families find the official rules? The answer is that the agency policy is currently being finalized. So the rate took effect July 1st. Reimbursements for expenses after July 31st are no longer accepted, and the document policy that governs all of that hasn't been published. Roughly 4,400 children are in care in Louisiana on any given day, and every one of them is in a household operating under a payment rule that is not published. There's no published appeal pathway, no defined exception process, and no safeguard that it points to. It does say in there about the CANS assessment, but it doesn't tell us who can request one, who's responsible for it, and what is the time frame to get their special board rate evaluated. Their own definition says the board rate covers reasonable travel for visitation, reasonable travel for a child in school, but there's no defined definition of what reasonable is. Does DCFS think that the 1,000 miles that this gentleman had his wife drive is reasonable? And the document that should tell us if it's reasonable, again, hasn't been published. And so when families are raising these concerns, they're pointed somewhere else. And I want to walk you guys through where. I did a lot of homework over the past week. So, like I said, I'm previously a kinship navigator. That means that I went into kinship families' homes and I helped them with the certification process to try to make it quicker. So kinship caregivers, they have two options. They can go the route of getting certified and they can get the board rate, which is now about $900, or they're offered the kinship care subsidy program. So that is $450 a month, but it requires less legwork like you have to get your board rate. But there's a lot of restrictions and barriers when it comes to that kinship care subsidy. Like, you have to make under 150% of the poverty level. So a family of 4 that used to be a family of 3 that took in their niece or their nephew can now only make $49,500 to be eligible for that subsidy. I don't know about you guys, but when it comes to family planning, myself and my husband have planned our finances and our income based on the number of children we have. So when you get a call about a niece or a nephew who needs help, you don't magically have that money just sitting around ready to take care of that child. You need help from the state. And then the worst part is fictive kin are excluded entirely. The qualified relative list is blood, marriage, or adoption. So a godmother receives nothing. A church member who gets a phone call receives nothing. That was us, twice. So for mileage, families are told to contact the child's Medicaid managed care organization. Before I go further, I do want to just say that the department extended medical mileage reimbursement through December 31st. And I really do appreciate that. That gives time for families to figure things out. But it also only covers medical trips. It doesn't cover like school or go into a Cub Scout meeting or taking a child to a visitation. So what I did is I did what the department instructed. On Friday afternoon, I wrote the DCFS liaison of one of our MCOs, and I asked the simplest question. I said, can a foster parent submit for mileage, and what is the rate? And so the answer was yes, a foster parent can be reimbursed. Because when I first read the announcement that we got from DCFS, I was a little confused because it said in there that only people outside of the home could request that. But she did say that it was a yes. But here's what else came back. I was referred to DCFS caseworkers. The DCFS liaison of the MCO could not say this is the pathway through the MCO to get that money. She said, I'm going to refer you back to the kids caseworker to be able to do that. So I was just ping-ponged right back. I was told that our past approvals, to her knowledge, have been single case agreements where Medicaid transportation was unable to bring the child to the appointment. I was given a per mile rate she was not certain of, and then 6 minutes later I was sent the table of federal tax rates showing a different number. So I was given 3 different answers in 6 minutes by the same person that's supposed to be the most knowledgeable on DCFS things for that MCO. And I'm not criticizing the person who answered me. She replied on a Friday afternoon and she was trying to be helpful. I'm telling you that the system foster families are being directed to could not answer a basic question about its own eligibility or rate. And that's not just one phone call. Louisiana's own Department of Health has fined 4 Medicaid managed care organizations over $1.27 million since 2023 for failing to provide the exact service that they're directing them to use. Penalties for not carrying out the rides like they're supposed to, showing up late to the rides, or not picking them up from the appointment after they were done with their appointments. And so it only covers Medicaid services. Like I said, visitation, things like that are not included. What remains is that our foster parents are going to now be expected to give 48 hours notice of an appointment to a third-party Medicaid transportation company, excluding weekends or holidays, with same-day trips generally unavailable, and the broker picks the route rather than the family. And so with Medicaid transportation, if you're not familiar, you can end up in a transportation van with other people, not just your family, not just your kid. So I spoke with somebody that drove for Medicaid. Elizabeth Kent drove for Medicaid transport here in Louisiana, and she told me that on the hardest of routes, she would sometimes drop a patient off at 6 in the morning, and she would not pick them up until 8 p.m. at night. And that was a cancer patient that she was referring to. Nothing about that changes. No routing changes for a child. And so I'm going to tell you what that means as a clinician, as a licensed professional counselor. You do not put a kid with a trauma history into a third-party Medicaid transport van with strangers for 3 hours, 12 hours, and call it transportation. And no foster parent's going to put that kid through that. So she's going to get in her car and she's still going to drive those kids to those appointments anyway, and she's going to eat the cost. An alternative that excludes the people who needs it can't explain itself when someone asks, isn't an alternative. It's just yet another place that we're trying to send people to. And then Louisiana's own 2025 to 2029 Family and Children's Services Plan, the state's federally required strategic document, reports preliminary review data indicating that the agency is using placements of convenience. The department wrote down that information about themselves before this change took effect. So fewer viable homes means workers place kids where there's an opening rather than it being a good fit. And so the cost later shows up in disruption. So S, the child that I took care of, had 18 placements before she got to me. And so that is why adoption was never on the table for her. A placement built on convenience rather than fit is a placement that's most likely to fail. And every failure raises the odds that a kid lands in something more restrictive, like congregate care. And congregate care costs 6 to 10 times what family care costs. So the child who can't hold down a family placement doesn't leave the system's books. They become a much larger line item somewhere else for years with worse outcomes. The state saved money the day that we said yes to S, and they just have removed the mechanism where we would be able to say yes again if this were to ever be a call. I closed my schedule today as a clinician. I did not see patients, and I'm not paid for this day. Foster parents do that every single month for court dates, family team meetings, therapy appointments, and no one reimburses them for that either. And I want you guys to really think about who they're expecting to absorb this. Nationally, census data shows that households caring for an unrelated foster kid, they earn about $18,000 less a year than the typical family raising the same amount of children. And 38% of foster households live below twice the federal poverty line. I do not have a Louisiana-specific number to give you, but there is no reason to think our foster families are wealthier than the national average. These are not families with room in the monthly budget to quietly cover what DCFS is wanting to stop paying for. Sorry, I had questions, and then I heard you can't do questions. So, members of the committee, ordinary people like myself and the foster parents that are sitting in this room raised a hand for vulnerable and traumatized children, even when it was costly to us. Please raise your hand today for these foster parents and ensure that DCFS is doing their job for these children, because our children can't wait.
Thank you, Senator Barrow. You have a question? Are you?
You can finish it.
Okay, welcome to committee. Ms. Bowman, welcome back. Did your issue get resolved?
Yes.
Okay, great.
My name is Wanda Bowman. And I am a foster/adopted parent. You did well for speaking for the foster parents. I sit here practically all day and watch DCFS present presentations, documents, and the experience that I have experienced as a foster parent has been a great hardship. I heard them talk about training. What they say they implement, they do not. Not even with the foster training, not in my experience. Actually, in my little hometown, Tensall Parish, I feel a lot of homes was taken advantage of by DCFS. I say that because children was placed within the homes. They was not certified foster parents. I heard the young lady say that was placed for months at a time without any type form of assistance. No food stamps, no financial assistance of any kind. Nor was they properly told that they could have filed for kinship, which is a program that people that have children that are related to them that could apply for kinship. Nor was they offered training for foster care. I say that because I personally was one of the ones that was done like that, and others in my hometown. I got a knock on the door one day with a foster child. Was not contacting prior to. The worker that showed up with the child came in, told me and my husband that the child was in need of services, that she needed to replace that child because that child was in a serious situation in another parish, and the child had got in trouble at school, and the child was looking at the possibility of being expelled. She needed to move that child out of that area so that that child would be able to be placed in another area so that that child's education could continue. She told me that she would be back within a few days. I did not hear from her. 2 weeks later, I did not hear from her. I contact DCFS. DCFS did not contact me. The worker came back out to the home and said that she would try to get a placement for the child. Would it be okay for him to stay a little longer? We told her yes. I asked her about foster parenting. She told me she would get me the information and the classes. She did not do that. I pursued it on my own. I made the research. I found out where the classes was at. I notified DCFS concerning enrolling in those classes. I was challenged with DCFS because we didn't want to be just child Pacific. We didn't even know that they made that determination for us. We wanted it to be a home that any child that was in need of care could come to. This particular child was my goddaughter's son. So you can understand the case. Well, to be a foster parent, I think it was required for us to do a longer class of some type instead of the, 4 weeks, 6 weeks to be child Pacific. So we drove to Rapides Parish, which you know how far that is from my hometown, to take up the classes that was needed for us to be a full foster parent home. The state still denied us. At that time, that child that we had was on heavy, heavy medication. We took him to the doctor, which they had chosen, the psychiatrist that he was under, expressed to her his condition, and she decided to reduce his meds. The state decided that, I guess we didn't have the right to make those kind of decisions, and the child was removed. But the child had 2 other siblings that was in a group home in Monroe. When they took the children's mother's rights, one of the child was suicidal. He attempted in that group home to take his life. The other child ended up at a camp that summer, and she messed up her leg, ended up in a cab. That's when the state contacted me and decided that they would allow those children to come into my home. That's when they gave me those 3 children. I know about children taking children because I'm coming from a small parish, and my children, when I got them, I enrolled them in Delta school, which was in Fairdy, which was a better school. And I had to drive them there, and they was participated in sports and everything, and it was expensive. And yes, the state would tell us that they will reimburse us back, but when I would fill out my forms, they would correct them. They would take the mileages back as if they drove my distance. And they would give me what they wanted me to have. Calvin, oh, excuse me for calling his name, but one of the children had a serious problem in the school system. And we decided to homeschool them. And we really thought that was, and it was the best for him. And we contacted the Board of Education and got the approval that we could house him at home and educate him. That caused a problem with the state, us removing him out of the school setting and bringing him home. My husband is a valedictorian of his class, well capable of educating the children. All of them were special needs children. Anyway, they gave us an option to adopt those children. We had had them for 6 months, or they would remove them out of the home. We adopted those 3 children. They graduated, all of them, from high school, did well. I turned around, and my great-grandchildren got in a situation. They remained in the State Department for about 6 months before they released them to come to my home. They told me that I had to go back and get recertified, go back through training. We did. Once again, not initiated by them. We went through a background check again. The children was placed in the home. In December. In January of that following year, we went before the courts, and they were refusing us benefits for the children because they said that we had not completed our training. We completed the training. They wanted us to go back and do another background check.
Sorry to interrupt you, Mrs. Bowman, but can you, and my staff is telling me no one can
They
help
wanted us
hear
to
you
go back and
outside
do
of the
another
room.
background check. Within the court's setting, they was refusing to assist with Pampers for the baby. They was refusing to reimbursing me for the out-of-pocket expenses that we was using. And so they was refusing to certify us at the time. And the judge asked them why, and they said because they wanted us to do another background check. And they were saying because it was coming up to, I guess, 6 months, and we was meeting where we would have to do it again. And she said, but if they have already did the background check, why is the state requiring it? And she instructed the state to immediately certify us. We didn't get certified until 6 months later in August. That's actually 8 months later. As you know, if you're not certified, you cannot get the assistance, the special board and stuff like that. You can get kinship, you can get food stamps. But I'm gonna bring you up to date what's going on now. My children, my great-grandchildren was removed. Not because of abuse, not because of neglect, because of I asked for help. I was dealing with a situation at my home that dealt with the sewage in the home, and it was being worked on. Matter of fact, it was almost completed. It would have been completed. It was just needed this little part to fix it, and I was supposed to go and get it. I have emails. I have shared those emails with Senator Katrina. I shared it with the Department of Family and Services. I shared those emails with the legal department, with the CASA, the children attorneys, and everyone. I have not seen my grandbabies in a year and a half. A year and a half. They took them March the 2nd last year. According to the state, they have procedures, due process that even foster parents should be able to go through. I was not allowed that due process. 2 of the children is autistic. All of them are separated in 3 different homes. The baby was, well, I'll say maybe 15 months when he was taken.
Ms. Bowman, I apologize. I'm going to give you a break, and because these are your grandchildren that may be able to be identified because of their kinship to you, I'm going to ask Madam Secretary if she has anyone while she and her staff continues to testify who can be escorted to my office with you to discuss this particular case.
I need to say something. Ms.
Yes, ma'am. Go ahead.
I need to go on record to tell them.
Can you come back? I'm sorry to the mic.
I need to go on record to tell them the pain that my family have had to endure. My husband is a cancer patient. And my daughter, my granddaughter, they told her in the courtroom, according to her, that my husband made the report on her. She beat my husband on Labor Day. That was my granddaughter that I had been trying to get mental health for. And he ended up here in the hospital. I have always taken care of children, even when I was a child. Anybody in my hometown would tell you I have taken care of children all my life. I have taken in the homeless, the drunk, or whoever needed a place to stay. And here I sit before you all, and they have taken my grandbabies away from us for just trying to fix a sewage problem, not because of abuse, not because of neglect. And we have suffered dearly behind it. The money didn't mean nothing. I was took care of my baby anyway. I am a mother of 4 children, 18 grandchildren, and 9 great-grandchildren. The young lady that you saw come up earlier, her fiance, we got him from his mother when he came out of her womb. You think for 1 minute I would neglect my own? They act as if we had did something so wrong that we couldn't even have a visit. We couldn't even go see him. Really? Why did they do that to us? And nobody would talk to us. I have filed documents in court to be heard. I can't be heard that way. I have contacted the State Department. I have not spoken with you, but I did speak to Mr. David Madlock. I came down here last year. I brought my grandbabies with me so that he could see my great-grandchildren, the 2 that was autistic. He promised me in that office that day that Miss Bowman, they're gonna give you your children back. And they took them 1 month later and never gave them back. The water system was fixed the very next week and they still didn't bring them home. How could the state do that? How could they do that? They sit here and they talk and they say that they moving children because they are in abuse situation. I need to know from the state what abuse, what neglect made them come into my home and move my grandchildren away from us and then denied us visitation. Denied us visitation.
Are your grandchildren currently in foster care?
I don't know whether or not they've been adopted. I don't know. The mom is mentally disturbed.
Yes.
I don't know what he had. I don't know. I don't know.
I think Madam Secretary had someone that's going to escort you to my office because we are very limited on speaking on a specific case, but you came down here for some relief today, and someone is going with you to talk to you about this case. And at some point, hopefully, if the committee is over before you leave, I'll join you all with your permission. Okay? We are praying for you and praying for the children, and hope and praying that you get answers. And I think the young lady is waiting on you now to specifically speak with you regarding this case.
Oh, God.
Do you need any water or anything? Okay. Oh, I apologize, Senator Barry, you had a question for? I don't think she's in shape to answer questions right now. Welcome to committee.
Thank you for having me. My name is Ann Spink. I was a foster parent only 6 years when the 2016 flood came. I had to quit being a foster parent because we had a towing business and there were a lot of abandoned cars. But I sit here today and I'm almost in need of the Kleenex box. When I've been accused of being an intense person, and I'll admit to it, because when I do something, I do it 100%. Lacey Sims asked us to be what was called bridge parents. I was already 55. I wasn't interested in going to Girl Scouts and sitting out at soccer teams and sweating and stuff like that. But a bridge parent takes a child and keeps them until they find the proper home. My average was 2 to 3 weeks per child. In the 6 year we were foster parents, we did somewhere between 150 and 175 kids. That's 25 a year. 2 a month, if you're keeping track. I can still name, it's been 15 years, and I can still call the first names on over half of them. I loved every child that came into my home. I joined the Louisiana Foster Parent Association, and because of my dealings with our business, I knew how to advocate some. I became the Louisiana Legislative Liaison for the Foster Care Association and was instrumental in getting a couple of laws passed. One of them was about putting traumatized child in a car by themselves. It just blew my mind that it happened the way it did. I came to talk about the board rates, so I'm going to stick with that. When I was a foster parent all those years ago, I sat down and I studied the federal law, and I went into the USDA database, and I figured out what federal law demands that a state pays a child. And at that time, it was about 50% more than what the state of Louisiana was paying. And I took it to the foster care people, and I will tell you, the last time I was in this committee, and it wasn't this secretary, it was the secretary before, but when she said me sit down to start talking, she got up and left the room because I have a tendency to put people's backs to the wall. But 15 years ago, it should have been 50% more. And I am challenging y'all, hire an independent accountant to follow federal law and decide how much a foster parent should be reimbursed. And I looked it up. The average today, USDA says the average is somewhere between $12,000 and $15,000 to raise a child. That would mean they'd get $1,000 apiece. Now, that's about what the new board, some of the new board rates for like a teenager have gone up to almost that. But I want to tell you, we had children break our furniture. We had children swing from the ceiling fans in our home. We had them put holes in the wall. We had them put excrement all over the walls. And we had them threaten my husband to stab him. We had one took that foster care child back a few years later because I thought after the training I could do better with him. He threatened to kill both of us. These are not sweet little kids that you're babysitting down the street. Some of them are sweet little kids, but all of them have gone through tremendous trauma. And when a parent agrees to take them into their home, they're going, I'm going to love this child, and I'm going to do everything for this child that I would if they were my own. And then they find out that they have taken on the burden of not just, let me tell you, when a parent decides to become a foster parent, the first thing they do is go out and buy beds, dressers, linens, so they've already put out a good bit of money. Under the new Reimbursement Act, when a child comes into care previously, I think it's $400. I don't know, it's been a while since I've been in foster care. They spend $400 on clothing, some on toiletries, and some on luggage. Well, now they're saying the foster parent has to provide that. So that means that every time I accept a child, I know day one I'm going to put out $400 or $500 out of my pocket for them, when my reimbursement for that first month may be $700. I know foster parents, I've kept up with it over the years because my heart and soul is in foster care. When I was there 15 years ago, the maximum number of children in a home was 6. In the last 3 weeks, I've talked to 4 homes that have 10 foster children in them. Now, when they get 10 children in them, they don't have one minivan. They've gone out and bought a huge 12-passenger van. They haven't stayed in their 3-bedroom home. They've gone out and bought a 6-bedroom home. If they want to go on vacation, they have to rent 2 condos to do it. These are parents that care and love, and I always make so mad when I hear someone say they're doing it for the money. That just burns me up, because I know that my husband and I average $7,500 a year that I charged off on my income tax for child care, foster care expenses that I hadn't been reimbursed for. Now, we've only had really 4 foster parents here today out of the entire state. But think about it. They're working full-time jobs. They're going to 5 appointments a week. You know, they're dealing with kids that are autistic and medically, or even if they're just, you know, basically a normal kid, they've still been traumatized. They've been taken from their parents. And one thing I learned is when they age out, you know what they do? They search out their birth parents. And if there's any way possible they can go back with that parent, they do. So, you know, we're keeping children in care for years and years and years. And I really don't know this lady's story. I don't know anything about it. But I'm telling you, if she had a plumbing problem in her house and she had 4 foster children in her house, it would make a whole lot more sense for family services to get involved and help her repair a plumbing problem than it does to take those 3 children away from a relative and put them in 3 different homes, and they may wind up in group homes. And instead of talking $1,000 a month, you're talking $10,000 a month. So I was an original member of the Pelican Board. I passed legislation for children. My heart is in this, and I'm telling you, y'all, if you do not hire a forensic accountant, not someone with DCFS, an independent forensic accountant to look at federal law and determine what is, and the special circumstances for foster children, determine what is the right amount to reimburse a foster care parent, you're guilty of a crime.
Thank you. Madam Secretary, you can come take the table, please. I may be going out of order, but just... Thank you. In light of, and just to recap some of the testimony that we heard today, and I don't believe that this is refutable. The department presented reimbursements at the March hearings in finance for fiscal 27 year budget. A number of those itemized reimbursements and the mileage have been eliminated as of July 31st. Is that correct, with this change in policy?
Not entirely.
Okay, but are there, let me ask you this, were there items that were budgeted by this legislature that are no longer being reimbursed for, that were contemplated to be reimbursed by the legislature for fiscal year 27?
Yeah, I don't.
Yep, so Christopher Baum, Undersecretary for the department. So if you're speaking towards like mileage, clothes, school supplies, The federal statute on what a board payment is, it's called a foster care maintenance payment, specifically says those are included in your board payments. So those are already expenditures that we incur today, and we will continue to incur. They're just going to be lumped into the board payment that you're getting today.
So you're suggesting that there hasn't, with this change in policy, there hasn't been a cut to those reimbursements?
Correct. We are not accepting reimbursements for items covered in your board payment. There would still be expenses that foster parents could ask for reimbursement separately.
Generally speaking, and just to go over a little bit of the information, so Miss Speak, I think was the last lady, Miss Ann, we did follow the federal law in the development of this, and we did contract out to have that rate developed. The last time that the rate was set in the state of Louisiana, it was done within the department, and there really wasn't an actuarially sound way of doing that. And so what we had committed to is we brought in a vendor, PCG, Public Consulting Group, who does a lot of rate setting all across the country for different services. Rates related to child welfare, rates in the healthcare space. And so that's who we brought in to look at what the federal law says that we should be paying for. And then they used that information along with all of the Bureau of Labor Statistics information and input from others and all of the current expenditures being paid to develop what the rates would be for Louisiana. So within that, there are 4 rates. The main tier, the base pay, if you will, is what most of the foster parents are going to receive. It's what most of the foster parents have been receiving. And that encompasses all of the expenditures for what our federal law says that we have to have. The additional tiers that are contemplated in there are what we call today special board rates. But what we have seen when we examined it internally is that it is very inconsistent in the way that it is applied. So, for example, I have one child who has a 504 plan. He's 2 years behind in grade school. He was approved for a special board rate of $601 a month. And what the idea is that if there is additional compensation because our children have special needs or our children need additional services, that is supposed to ensure that their needs are met. And so for the case with the 504 plan, one would expect that there's some additional tutoring or other services that are being provided, but we did not take that extra step historically. And so with the additional 3 tiers, first, special boards have continued until we get the next 3 tiers done. But we will have a variation of the child and adolescent needs and strengths as CANS assessment that we've been using to determine needs, but what it's going to bring into it too is what needs of the children fall into each of the tiers, what the rates are going to be, what services are going to be provided to the children, and then a reassessment plan every 6 months. So I know that's a lot of words for your question, but I think it was just a little more complicated.
I'm sorry. I'm going to try to catch up later. Ms. Bowman has taken EO. We've called the paramedics. I'm going to stay with her till they get here. I'm hoping, I know you know how to handle this. This is more of a serious situation with foster care. Also, just in case they take longer, I have Ms. Douglas. She's a constituent that needs to get home. She was here for other business. She wants to just give, at some point, a brief 10-minute report on her OJJ issues, okay? Thank you. All right.
You finished?
I was finished.
Okay. It seems like, based on the testimony that we've heard here today, that we are making it harder to be a foster parent in Louisiana with this change in policy. I'm certain that it was unintended consequences with the change and trying to, I guess what I'm hearing is become more in compliance with federal law?
So it is to be compliant with federal law because we have to be in order to draw the federal match for any expenditures that we make. But it's also to ensure that
So were we not in compliance with federal law last year?
The expenditures for reimbursements, I think that's a policy of the department that could be argued based on where the funds are being paid for.
Okay, this is, I guess, what I'm going to ask. Delay the implementation of this policy change for at least through the fiscal year 2027, which started July 1. Am I saying that right? Yeah. Let's study this further. The intention of the legislature with the increase was to make it easier and more attractive to be foster parents in this state and not harder. And I think the policy changes, based on the testimony that we've heard today and the input that we've received from our constituents, where we may have taken a step actually backwards and not forwards. I'm not saying that was on purpose, but I would strongly urge you to pull back this policy, and maybe I'm the only one that on this committee. I doubt it. That is going to urge that, but it's pretty clear that the intention of the legislature is not being met by the policy change. Also, and if we can have this conversation offline, but I think one could make the argument that pursuant to RS 46-286, the Administrative Procedure Act, this shift in policy based on the level of care would have required a rule change that should have been reviewed by both the House and Senate Health and Welfare Committees, which we would have the opportunity to have this discussion there, and ultimately give an up or down vote as to whether we would approve that rule change. Now, I've only seen that happen one time where we don't approve a change in rule, although it was very recent. I could certainly make that case. I don't want to do that. I think based on, again, the information that we received today, it is now harder to be a foster parent in the state of Louisiana. Certainly that is no one in this room's intention. I would just strongly encourage you to not only rethink this policy change, but perhaps delay its implementation for at least this fiscal year. That's all I have to say.
We can do that. We can roll back the implementation.
Thank you.
Yes.
Oh, yeah, Senator Barrow.
Thank you, Mr. Chairman. And I certainly concur with your recommendation. First of all, let me just commend all of the foster parents for taking on that role, that responsibility, and actually making a difference in the life of a child. I just want to say thank you to each one of you for your heart and your commitment, because certainly you don't do it for the money. Whatever they give you is never enough, because there are a lot of things that come up that are never added into the equation that you just do because it's the right thing to do. And it's what you signed up for and what you agree to do because you see the need. And so I just, first of all, want to thank each of you for what you have done and what you are currently doing. I agree with the chairman, Madam Secretary. As I'm sitting here, some of the things I've heard today have been really mortifying to hear in terms of what families are going through as they are trying to help children who never asked to come here. That's the one thing I keep saying, because these children, they did not ask to come. And they've been born into situations that they did not create. And so they are acting out oftentimes based upon what has happened to them or what they have experienced. And so, I completely concur with the Chairman of Health and Welfare. I would hope that you guys would consider doing that. I hope that it would be a decision that y'all would make willingly, rather than having us to try to weigh in otherwise, because this is not going in the direction that I think any of us anticipated. I'm sure based upon my conversations with you, this is not what you anticipated. I'm sure that some of these stories should have modified you today. So I would hope that you guys would do the same. And I'm just going to leave my comments at that at this point, with the hopes that you guys will revisit. Sound like you said yes.
Yes, we will.
Okay.
We will roll back and we will have additional conversations to make sure that there's full transparency on the development and what it means. Yes.
Okay. All right. Thank you.
Thank you, Senator Barrow. Representative Freiberg.
Thank you, Madam Acting Chair. Please clarify, Madam Secretary, this would not put if we roll this back, this is not going to put our federal funds in jeopardy, the matching funds, correct?
No, ma'am.
Okay. Thank you.
Representative Coates.
Yes, ma'am. Thank you. So I agree with the senators and their thoughts. Kind of listened to all the testimonies, and I just looked up the federal title you guys had mentioned. But there are some extraordinary distances and stuff in there as well. So reasonable travel to the child's home for visitation, local travel with daily care. So the other thing that I guess what really bothered me too was kind of the federal floor versus the state mandate. So RS 46286, for one, it says it's only for 6 kids, and we had people testifying that there was 10 kids. So how is that even happening? The other thing was, so that federal title, its definition of a base maintenance payment can cover, but it does not prevent a state from providing additional itemized mileage reimbursements. Most importantly, federal statutes doesn't override the state law, which is RS 46286. So, which legally ties total foster payments to the USDA cost of care standards and requires committee approval before altering reimbursement statutes structures. So, again, like Senator McMath mentioned, that state statute required you guys to go to the committees before you ever changed the rates and the payments. So, that's a little disturbing that we were trying to move and this was going to cause hardships for these foster families. I have a foster mom that I was working with a few months ago because they were adopting a child, and it's taken months and months and months, and finally she got it through all good. And I reached out to her when I heard about this, and she's like, I'm still due payments from 2025. I'm still due reimbursements. If we're trying to help this foster program in the state, why are we making it so hard for these loving people that are taking these children into their homes? So I guess, one of the questions I want you to think about as you guys move forward is also Section 475-4A of the Social Security Act, which allows routine local travel to be included in daily care payments. So it identifies travel for family visitations as a distinct obligation. So DCFS reclassifying long distance and court-ordered parental visitations or routine local travel. Are you trying to avoid paying these separate mileage reimbursements that they have the rights to? So just kind of look at that. The shift of the federal program. So The federal title relies on states to ensure foster care children maintain family connections and access required medical treatments. So by bundling all the non-medical travel into a single flat rate without providing this clear pre-approved process, are you putting that financial burden on the families and kind of getting out of what the federal government even is requiring? You guys, cited that federal title to bundle all that local travel into the monthly board rate, but the federal law also sets a baseline floor that doesn't strip the legislature of our law. So again, I want to go back to the 46-286 that we already set in law that we're going to use that USDA standards. So I just wanted to be very clear. I have some family members or distant family members that has been foster parents and taken children in, and I know how hard it is. I know how hard it was. And if we don't help these parents and keep this going, we're going to have more kids on the street. We're going to have more mental distress. We talk about, mental health all the time. And if we don't have someone that is truly taking care of these children because they want to, then there's not going to be anyone else to. They're going to be in homes, or they're going to be on the street, or they're going to be in jail. So I appreciate you working and looking into this and listen to our concerns as well and to the concerns of these foster families that actually came today. So thank you. I appreciate y'all guys letting us be involved today.
Thank you, Rep. Coates. So on that, as I understand it, what we're doing is asking for the rules on reimbursement to be looked at, not to lessen the increase in the board rates. Is that it? So, and you'd indicated we're looking at some of the reimbursement. You said there was still some work to be done. You said that a little while ago. So was that what you were looking at, were the reimbursement rates?
So there's two main areas that we've heard from our foster parents. The first was related to medical reimbursement, which I wholeheartedly agree. We have some children with very special medical needs that there are not providers in certain areas, or there's not specialties of providers in certain areas. And so they're having to travel to get the kids the services that they need, which we appreciate them doing that. There are two ways that travel can be provided, and this is covered under Medicaid because all of our kids are covered by Medicaid. There's not an intent to have them to use transportation services, albeit they are available should they want to use them. The other option is that they can request reimbursement for the mileage for the traveling related to medical care that they're doing. So I just wanted to make sure that I say that we're not intending that everyone has to use Uber or Lyft. It's just there are varied services that are available under Medicaid based on the needs of the family. The second is related to the tiered payments. So the baseline, as you're speaking of, Rep. Coates, that is the rate that we had put into place. And then there's additional tiers that are being finalized. The rates were already provided to us as part of the rate setting process with our vendor, PCG. And those rates, I believe USDA stopped publishing data. It's the Bureau of Labor Statistics that does it now. And that's the rates that we used as part of the development. But we do recognize that there are children in our care that our foster parents are providing care for that require specialized services, additional services. They have a higher level of need. And so the special board that was in place today has continued until we can review each of those to understand exactly what has been approved. One, what's been approved is on paper, and this is all across the state and approved by different levels of individuals. So there was not a systematic way for us to look to understand what the needs of the child were that predicated the approval of the special board. So again, special board was continuing until the new tiers are approved, and then we would transition children and families to those.
Have you all done this in consultation with the foster families? I mean, did they know? Was there any kind of sharing of information and concerns? Because that would be really helpful, I think. If you want to get buy-in, they need to have a voice besides coming here to tell us.
Fair enough, yes. When we brought the partner on board, one of our main objectives was making sure that foster parents were part of this. And despite our best efforts, we did not get the level of engagement in or the communication out. And I think that's what's led us to where we are today. And so we're going to take that back and continue working on that.
Thank you. Senator Barrow.
Thank you, Madam Acting Chair. I forgot to ask this question earlier, and Ms. Coates, Representative Coates, when she brought up the transportation piece, because I heard many of the foster parents kind of reference that component. So were they being asked to actually use that themselves to bring the children? Were they asked to send them without an adult to be with them?
No, they could request reimbursement, but if there's any individuals who are receiving Medicaid that need transportation, non-emergent medical transportation to appointments, that is covered as well. So it's kind of an either-or situation.
Okay, so they didn't have to use the transportation service or company. They could use Uber or Lyft if they wanted to.
Or request reimbursement.
Okay, yeah, that's what I meant.
Yes,
but if they can request to use that and get reimbursed.
Yes, ma'am.
Okay, got it. Because I was
Hold on one second, Senator. You have an email, and I meant to ask for it. You had the gentleman. You had an email. Did it tell you you couldn't do that? I'm just making sure. You said you had an email and you had it at the table.
Yeah, tell him to come back.
Yeah. Because I want to make sure you get that email. You have it. Okay.
So the way the email explains it is we can get reimbursement, but we would be going through Medicaid. So, and it's more cumbersome on us. Now, I know we were trying, the statement was we're going to get rid of the cumbersome reimbursement and all the paperwork, but that's really just getting rid of it on the DCFS side. This was sent to us. You have to call NEMT broker and receive approval before traveling. And I don't know how many hours you have to do this before. The other lady had said something about a couple, maybe 24 hours. Then you fill out all this documentation. You got to get the physician to sign it. Didn't have to do any of this before. We just kept track. We'd give it to our caseworker. They would take it. They would process it. We'd get paid.
I want to see that email, sir, the committee.
And the email, that one. If the idea was to really help, then do the rate increase and leave everything else alone. I mean, the rate increase, that would be nice. You know, it comes out to almost $10 a day for a child. Well, give the foster parents that, but don't give it to them on this hand and then on this hand, take it away. So to me, what really would help is, and I think y'all approve the rate increase, but yet somehow, instead of there just being a rate increase, there's been we're really fooling with a lot of stuff. And I know that it was, the Secretary mentioned about buy-in, but on some paperwork that they sent, I think it says 42% of foster parents participated in whatever survey this was. I'm not saying I didn't get it. You know how you get so much junk mail.
Right.
I'm not saying I didn't get it, but if I would have gotten something explaining what we have just done, now if it came in saying, we're going to give a rate increase and would you like the paperwork to be less? Well, you may say, yeah, I'd like the paperwork to be less, but you're not really given what would the end product is. So I would love to be a part of this. And again, I'm not saying that I wasn't contacted. I'm not aware of being contacted.
Well, I want to say again, thank you, for your service and your commitment. And I'm so glad that y'all came, because we would not have known had you not shared that information with us. And certainly it should not become more difficult for you to really help the state to be able to provide these services to kids who did not ask to come here. And so you're doing your role and responsibility to get them, provide for them to have a good start, or at least have an opportunity.
Yes.
To have a good start. And so I applaud y'all for that. Madam Secretary, I think you've answered our question. So you guys are going to roll that back, right? We rolling this back, right? Is that the agreement? Okay.
Yes, we will do
that. Because this is definitely problematic, and I definitely understand what you're saying. I really do, and I appreciate that. So we clarified that component of it. And I guess just going forward, I mean, we have, to me, what I call the protocols in place to ensure that, as best we can, when we make a decision, that we are looking at everything. And so we have the committees that are assigned to look at this so we can hear all conversations. Because while we think sometime in our mind that it's a good idea, the actuality may be that it's more cost prohibitive. So, again, I just want to say thank you. But I'm glad you brought that up, Representative Coates, because, that was in the back of my head as I was listening to other individuals who had come to the table, and I'm glad that issue came back up before us.
Sure. So are we rolling back the rate increase too?
You're not rolling back the rate increase, correct?
No.
Oh,
That rate increase is by legislation, right?
That's right.
Okay, let me make sure. The rate increase is by legislation.
Right.
So can you clarify what your ask is? Because I thought Senator McMath was asking us to reverse all actions that we've taken.
No, he was at all actions that you took outside of the legislative instrument. Because who was that? Senator Kathy? I can't remember who the author. We voted.
Yeah, it was an HB1.
HB1. So HB1 legislated a rate increase. That cannot be undone without a legislative act that has been legislated and appropriated.
Okay.
What Representative McMath was asking is that anything outside of what this legislature did be rolled back. The rate increase was legislatively appropriated.
Okay. So and I just want to clarify to make sure that we're all on the same page. So the medical mileage reimbursement, the ask is for DCFS to continue making those payments through the end of the fiscal year, correct?
Well, let me make sure. We want the mileage reimbursements brought back to the way they were. Okay. What else was changed? Special board rates was changed. What Senator McMath, Chairman McMath, was asking was this, is that the only change this legislature expected this year was a pure rate increase, not that anything else would be restructured. So what Chairman McMath and this committee is asking, because we believe that any other change besides that rate increase should have came before the committees, on the Joint Health and Welfare Committees. We should have been notified of it, or the appropriations, because it's a finance issue. Some committees should have been notified of those changes. That's what his belief is, and we share that belief. And we should have had an opportunity to have oversight over it.
Right.
Now, we have all been extremely busy, Madam Secretary. I'm not saying that didn't come to us. I don't remember seeing it. Maybe someone from your legal counsel can tell us whether we ever received something saying these changes were being proposed and were going to be put in place.
Well, I think we probably weren't clear. I know in some of the conversations that I had, it was that the goal was to have a fully burdened rate that included all of the expenditures so that our foster parents did not have to keep coming back to the department. So I may not have been clear with that.
It was a pure, now, from what we legislated, the pure intention was a rate increase, not that we would take anything away. But that they would get a rate increase on top of what they were already receiving.
Understood.
So am I understanding that the rate increase stays, but the reimbursements and the special board and all that we used to have, that stays also? And
that's what this committee is asking to the end of the fiscal year, when we can all come and do an oversight committee.
And
that is the request.
And if that was what was originally presented, I think a lot of people would be
I think that that's what the legislature believed it was voting on when they voted on House Bill 1.
Exactly.
That it was going to be a true increase to the people who were taking care of foster children. I apologize if that wasn't fully communicated. Now, I think in those conversations, if I remember, there were conversations about if we can make any paperwork for foster parents less burdensome to do so, right? And so that was probably the caveat that maybe the confusion happened, was, hey, if you go and there's a simpler form for the rest of the reimbursements, create that simpler form, you know. If we could streamline the time they get paid in reimbursements, let's streamline that. It's essentially the request that we understood was we're going to give them a blanket rate increase. And then we're going to do everything we can to simplify everything else they receive. Because we understand that although it's a joy for them, there is a burden of paperwork. It's a joy for them to take care of the children, but there's a burden of paperwork. And so that is what the committee ask is, until such time as, and maybe legally you all believe that HB1 gave you something different. I'm asking my staff to pull that language up because I want to be, and print it out for me. I want to be very, very clear as a committee on what the language said. Okay?
As they are pulling it up, I have one more question.
Oh, yeah, go ahead. I apologize.
Madam Secretary, can you or someone from your staff tell me how much is currently owed in terms of reimbursement to foster parents in that transportation cost? Do y'all know?
I would not have that number right now, but I can get that for you.
Okay. And make it available to everyone on the committee.
Yes, ma'am.
Thank you.
Representative Coates for a question.
I have one more question, kind of thinking through some of this. Why does I guess I'm going back to adoption that we were talking about. So an adoption stipend is not raised with the increased match of 80% of the board rate?
No, ma'am. Adoption subsidy rates are agreed upon at the time of adoption based on the needs of the child, and those are set.
Okay. Just wanted to make sure because that was kind of sticking out. One other thing that was brought to my attention with some of these rate changes and stuff. So there's parents, because came up, the special board rates, adopt those children with those rates for medical needs. But because of their income, they don't qualify for SSI or disability or anything. So under this new proposed that you're going to roll back, but they would get neither, correct? Because you were kind of pushing them to use Medicaid and stuff, but if they didn't qualify, they kind of didn't get any reimbursements. Is that correct?
Are you talking about adoptive parents?
No,
I'm sorry.
this one, I'm sorry, this one goes back to foster care.
Could you restate it?
Okay,
I'm
yeah.
sorry.
So parents that adopt the kids with these special board rates that has medical needs. So with if their income didn't qualify them for Medicaid, then those parents wouldn't get any reimbursements under this new proposed?
We did not make any changes with adoptive parents.
Okay, this is foster care.
You said that.
Oh, I'm sorry. Did I? I apologize. It's been a
Sorry.
long day.
I know.
It's been a long day. We all been here.
Okay, so then foster parents with a
Yeah.
special board who don't qualify for SSI.
Mhm.
I'll have to check into that. I'm not sure the answer on that.
Because that was one of the questions that was brought to me. So I just wanted to kind of bring that up.
Well, yeah, and Chris has said, yeah, we'll have to look into it, but every child in foster care is enrolled in Medicaid to cover their services. So but I will take that back and we'll get an answer.
Okay, yeah. That was just one of the other questions I had on my notes, and I forgot to ask earlier. So thank you. Thank you. Appreciate it.
Do we have it? You guys are so efficient. God, I wish I could search as quick as you. Yeah, we're just going to look at this language real quick that authorized the rate increase. Thank you so much.
Parents with special needs because they don't qualify for SSI.
Okay. So the language added total amount $715,706 provides funding for. It's the next one. I knew that was a small number. We added total funding $16,863,000. Provides for funding to increase foster care board rates, adoption subsidies, and guardianship subsidies. That's the full language of the bill. That's kind of the full language we wanted to increase.
I'm sorry. Did it say adoption subsidies and?
Yeah, it says provide funding to increase foster care board rates, adoption subsidies, and guardianship subsidies.
Well, I think that got excluded, didn't it?
So to clarify, adoption subsidies are up to 80% of the board rate at the time of adoption.
Right,
So if
right.
we're upping the board rates.
Okay, so
today-
it doesn't change then later.
Correct.
Right.
Is that
Not retroactive. It would be prospective for any parents who are an adoption placement right
point.
now. Yes.
That's the adoption subsidy, yes. So
so y'all understood that not to be an increase? It was just going to be
prospectively for that at the time of adoption. Right. And I'll go back and check. I can't speak for the entire legislature.
Understand.
Yeah. So what I'm seeing here is the same thing that the chairman said, that this was a blanket increase. It had nothing to do with paring down. Now, we did talk a number of times on the record about simplifying the reimbursements. That didn't mean, unfortunately, that didn't mean take them away. It just meant simplify. Make sure that adoptive parents, I definitely know it didn't mean that we wanted to see them go through the Medicaid process, or that foster parents would have to call Uber or any transportation service unless they needed them, and that was the way they were transporting before. For a foster parent who had a car, who had to take a kid, like the young lady testified, I think that was your wife, right, to 10 different appointments, we didn't mean for her to call 10 different Ubers in a week.
Yeah, that would not be our
Does it-
expectation.
yeah. Or that they would have to switch over from a system that was very simple with them turning in a form to turning in something to Medicaid, and the Medicaid management companies, fine-toothing and denying. Because honestly, we would have, I know I wouldn't have, I don't think any member of this committee would have, sent, we deal with the Medicaid management companies on a number of issues, just being straightforward. We know the denial rate, so we would not have expected them to shift over to that. If they didn't have transportation of their own, that may be a good idea because it's always been an option. But I think, and look, we didn't know, and we've heard testimony. I really forgot the testimony when we were dealing with the Uber and Lyft and adding them to Medicaid management was because sometimes people get picked up at 2 and don't get home to 6.
Mhm.
Yeah, and so we definitely would not have encouraged in any way for them to shift to Medicaid management or wait on the Uber. When you call the Uber, that's 10 to 15 minutes. Sometimes parents are 10 to 15 minutes away from home. We didn't mean and intend to add any extra burden on foster care parents. We take and honor us on that if that was miscommunicated as well. We take our partial ownership on it. I thank Madam Secretary for being willing to roll that back and let us have an opportunity to look at that. But when I voted for it, I voted for a pure increase. When I went home and told foster parents, and I think everyone on this committee did, you're going to get an increase. You're going, because we believe they needed it. That was the encouragement to add more foster parents to the roster, and to make those, to make sure those foster parents who were fostering children had a, extra incentive. Not that they need them. I just think there's no incentive enough but your heart that's going to get you to foster a child. I believe that. So, I apologize. Senator Barrow has a follow-up. And again, Madam Secretary, if we miscommunicated that, my sincere apologies from the legislature, but that's why I wanted to read the language. Okay? I'm trying to cut it on, Senator. It's
Just a
glitching.
follow-up to my question as it relates to the reimbursements that are owed. For those that are owed, I would like to know when is the term to actually pay those individuals. When y'all find out how many you have that you owe in 2025, will you let me know also when you guys are expecting to reimburse them? And then lastly, Madam Chair, I would like to make sure that at some point we bring in the managed care organizations. Certainly, I would like to hear and have them kind of weigh in on some of these matters, especially as it relates to the transportation piece. I just would like to know in terms of what they are doing and offering.
Most definitely.
Thank you.
The board is clear, Madam Secretary and staff and all of the constituents. Ombudsman, do you have anything you'd like to add to the conversation? We are bringing you in September, and don't shake your head like you're not coming back because we have you on the agenda for September. We did a full day, and we explained to everyone of this and hearing from everyone. I know I'm coming to you, Ms. Douglas. Okay, because we wanted to hear from everyone. Constituents are welcome back. We're bringing in some presenters next time, and we're going to work with your schedule early, Madam Secretary, for September, so that we can have some, talk about resolutions, how we get past this. One thing I've learned today is communication and things in writing go a long way, even with the the increase in reimbursement. Something in writing besides, the one line that was in the budget would have probably helped before we were here. And so thank you so much.